Good morning, everyone. Mr. Lawfer, I think we're ready to begin.
We're ready in the hearing room, and we are streaming on YouTube and the Cali PA system at this point.
Thank you so much. Well, good morning again, everyone. My name is Joaquin Esquivel. I'm chair of the State Water Board. Today is Tuesday, December 1st. It is 9:30 a.m., and I'd like to call this meeting to order. I'll begin by introducing my fellow board colleagues. I think running a bit late, but with us today will be Vice Chair Doreen Diadamo, with us as well as Board Member Laurel Firestone, Board Member Sean McGuire, and Board Member Tam Doduck. As you can see, this meeting is being webcast and recorded in order to comply with the COVID, in response to the COVID emergency, in order to comply with the governor's executive orders. We don't have a physical meeting room. Instead, we have this platform, the Zoom platform, in order to meet virtually and then also take comments. So you are either viewing us one of two ways. You're either on the live stream, customarily watching us, but if you intend on commenting on any of today's items, then you'll need to be here on the Zoom platform. And so you should have received already a link and a password from the clerk of the board. Instructions on how to do so are at the top of today's agenda. But if you need to get on you're watching this from the webcast, you need to get on here. You can email comment letters at waterboards.ca.gov, and the clerk will help you get in here. With that, I think, and just please do remember to speak clearly into the phone and your microphone when you come up. And again, this is all being webcast. So with that out of the way, I believe we can move on to a public forum where a member of the public wishing to speak on an item, and I'm not seeing anyone currently for public forum. Is that correct, Mr. Lawfer?
Yes, that's correct. We have no speakers for public forum today.
Great. And then we can pass on to that. We do have a quorum here. Yes, the three of us. Sorry, I was thinking of Tam here as well. Then with that, we can move on to our first item, which is adoption of the board meeting minutes from the prior board meeting.
I'll move for adoption.
I'll second.
Great. Ms. Townsend, can you please call the roll call vote?
Yes. Board Member Firestone.
Aye.
Board Member McGuire.
Aye.
Board Member Doduck.
Aye.
Chair Esquivel.
Aye.
Thank you.
Thank you as well. And the vote carries, and the board meeting minutes from the November 17th board meeting are adopted. Next, we have our informational items, and we have just one today, item number 2, which is an update on the board's actions and responses to COVID-19. I believe Mr. Darren Plahanis, our director of the Division of Drinking Water, is going to give us an update on the survey that our staff have been conducting to understand household debt and arrearages and their impacts on systems. Darren, good to see you this morning.
Yeah, good morning, everybody. Actually, I'm going to have Max Gomberg go into details, but and Sean McCarthy as well. We can report pretty much success. It was a big effort, obviously, and took a lot of DDW staff time, but I'll let Max give you the numbers as of the last. They've been running them continuously to see exactly where we're at. So go ahead, Max.
So Max is just joining us, so give us a second here. And Max, for your benefit, if you can hear us, Darren just did your introduction. Very good.
Well, Max gets situated. Any sort of general highlights that you want to touch on, Darren?
Let me do that. So generally speaking, when I checked with folks on Monday, we had over 400 entries into our survey, recalling that this was a manual phone survey. So it was a lot of effort. Staff spent about 2 weeks trying to contact some of the smallest water systems in the state, which took quite a bit of time to do that. And basically there was a lot of last minute trying to pull it together, because we did have a cutoff date of right before the holiday began to make sure we got those in. So if you're ready, Max, you can go through kind of what you know.
Sure. Thanks, Darren. Good morning, Chair Esquivel and board members.
Yeah, it's good news to report. Darren's staff did a fantastic job reaching out to all of the water systems. We targeted 500 small and medium-sized water systems for direct phone calls, and having a staff person be on the phone, particularly with the smallest systems, and walking them through these questions about finances and economic impact. So it was a big lift, like Darren said, and we're really pleased to report as of yesterday, we were over 400 responses from small and medium-sized systems, 414 to be exact, for systems with fewer than 10,000 service connections. So it's a good place to be. We're pretty confident in the quality of the data, although we're still going to spend a few more days doing some follow-ups, making sure that where numbers seem off, we're going back and fixing that, so we have the sort of most the strongest data set we can have to really inform all of the analysis and uses of it that may occur over the next 12 months. And of course, this was not just a survey of small and medium-sized systems. We also wanted to look statewide at the household debt issue as well, which required reaching out to the larger water systems that serve the majority of the population. So the systems with over 10,000 service connections, we targeted 130 of those, reached out to 150. As of yesterday, we were close to 90 responses, with another nearly 20 that had asked for an extension through the end of the week. So we're getting close. My staff are going to be working hard this week to ping the systems that didn't respond and try to get us up to that target number of 130 responses. And again, what the reason we were aiming for these numbers was so that we would be able to extrapolate and really make statewide estimates about the entirety of the water systems, as well as the statewide household debt level with a high degree of confidence. So we're close to being able to do that. And again, really want to give my sincerest appreciation to all of the staff that work on this, but particularly Sean on Darren's staff, who really led a lot of the work and did a great job. So we will, in terms of the timeline from here on out, we're going to be getting the rest of the responses in this week from the large systems, and then we'll really, we're doing quality control. We'll really be spending the next couple weeks going through the data, analyzing it, make sure we understand it, and we're prepared to come back to you on January 5th with a full presentation about what can we learn from this really unique effort to capture information on the entirety of the impacts from COVID on the water sector, the drinking water sector in the largest state in the country, with 40 million people and nearly 3,000 community water systems. So it was a big lift, and I'm excited to be able to come back in January and really talk about what this data is and what types of conclusions and we can glean from it. So with that, I'm going to hand it over to Sean.
Thanks, Max, and good morning, Chair Esquivel and board members. I don't think I really have much else to add to it. I just wanted to comment that our staff, I think, did a remarkable job in contacting over 400 water systems in the last 2 weeks alone, really much in the last week, to reach out and get usable data for this survey. I think it was a successful effort. They gave it their highest priority and made this an emergency response item. So I'm really proud to have the numbers in front of the raw data in front of you today. Thanks.
Yeah, and I would just put a fine point on that. Sorry, Chair Esquivel.
Oh, it's okay.
Just that, we did dedicate a lot of time to it. Sean basically has been spearheading this and on it almost, I'd say, over half time, and a lot of our DEs to make sure we had good quality data, spent a lot of time pouring through it. So we basically worked on this for the last 2 weeks. Of course, it's a very important topic to do, but I do want you to know, the effort of the staff and what it took to accomplish this. And hopefully we now have some really good data to work forward from for this emergency response.
I know it was no small ask from us to really kind of put pencils down on other work so this can be prioritized. And so I just want to extend my incredible thanks. And it's not just remarkable, Sean. I think it's Herculean. And so I really do appreciate what the Division of Drinking Water and all the water board staff that have been involved in this project have done. But because to Max's point, this data set is really critical for a policy discussion in the state that we need to have. And without this information, it's hard to really have it. And so this is a first step, and just want to acknowledge as well the systems that worked with us and responded, and know that it's not easy to open up the books that way. Sometimes it can feel a bit intrusive, particularly from a regulating entity coming in, but what is at the heart here are the issues and the outcomes that we're looking for. And knowing that with this incredible economic downturn that we're facing, with these incredible circumstances that mean we're all here, meeting virtually for the last months, have to look at the work a bit different. And I hope that what is lasting is the trust, perhaps it's been built from the district engineers, from the Division of Drinking Water staff and the systems, to talk more about these challenges, to help us understand the challenges that you're facing out there, so that we can be more responsive with our program, so that we can be better at this in this moment together. And so just thank you for the leadership, Darren and Sean and Max, and my fellow board members here as well for saying this is our priority. We want to see some resources put to it, and know that it does come at consequence to other core work that we do. And it isn't easy to spool up this sort of effort, but the situation called for us needing to not let not greatest response on the voluntary side. And there's plenty of reason. I can understand why there's a lot going on, and for us to put some resource in to make sure that we get the information. So thank you. It was an appropriate scale up, and I just have just incredible amounts of respect and thanks again for this. So
yeah, thank you. And I think you hit the point exactly. We definitely need to thank the water systems for participating, and even those that didn't participate, because obviously we didn't get to some work that we should have been working on for other water systems. So we appreciate their patience going forward, and we'll get back to our main tasks and appreciate it. So looking forward to the data to come out of it. Thank you very much.
thank you as well. Any other questions or thoughts from fellow board members?
Well, I'll just add my thanks, and I just am really impressed and proud and thankful for the staff that made this happen so quickly and effectively. And for the remaining systems that haven't responded yet, I would just encourage staff to not only ping them, but also use us and the water associations and other folks to help make sure people are aware of the importance of this and how to do it effectively. So, just again, so impressed and grateful and proud of the team, and also really grateful for the swift response and trust that water systems are providing. And I really do hope this is kind of a model for how we can work through collecting data effectively from water systems, hopefully with it, not from a staff effort perspective, but from a, working with water systems and making sure that we're building on that trust and really focused questions and kind of interfaces. So thank you.
Yeah, I'll just add my thanks as well to everyone who's worked on this so far, and the work yet to come, I think, because a lot of this will this is the springboard, really. I mean, January 5th will be your report, Max and Sean and Darren, and we'll see what the numbers hold and really what the next step is. And for me, this is really trying to get an understanding of how big is this challenge that we're facing, for 2021 and beyond. We don't know right now. And so I'm really anxiously looking forward to seeing that information, to continue to work with all the water systems out there, with community organizations, with the water associations and systems to really try to, once we know what this problem is, identify solutions and, work with others to implement them. So I know that, we were debating, deliberating different options here, whether it was using our mandatory authority for orders or taking this voluntary approach. And the survey earlier this summer, didn't get quite the response that we were hoping to. So I'm just so encouraged by what we've seen here in the recent weeks, especially, even during the holiday season with everything going on. Just thank you to everyone who's been involved. And again, looking forward to that discussion in January.
Thank you. I'll just ditto what my colleagues have said, and especially what Board Member McGuire just said. I know that we had a debate about how to proceed, and I'll have to confess I was leaning towards the mandatory because I was concerned. So I appreciate this check-in in December, and I guess for the time being, I appreciate being proven wrong, because the collaboration and the information that we received was tremendously helpful. And again, I look forward to seeing how this goes in January. Thank you.
Thank you so much, board members. Any following last thought there, Darren, or others? But otherwise, we'll see you in January. And again, it's been an incredible timeline. Executive Director Sobek.
Thank you, Chair Escobar. I just wanted to say one thing about COVID that's unrelated to the survey, just to remind everybody. I know everybody knows that there's been an uptick of cases throughout the country and throughout the state, and we all need to be in a stance of increased vigilance and precaution. There've been we've sent out guidance that's come from the state to employees, people who are in the buildings now. We have very strict must wear masks at all times in the building, in all places in the building, in Cal EPA buildings or water board buildings, unless you're in an office with 4 walls and a ceiling. So people who are coming into the office and sitting in their cubicles must wear their masks at all times. And, I know that this is not everybody's preferred mode of working, but it's really, really important for everybody's safety that everybody follow those precautions. And I know that staff that is essential and does need to either come into the office or do inspections out in the field, that they will respect all of those rules to keep themselves and everybody else safe. And I really wanted to thank them for doing that. We are continuing with our encouraging everybody who can telework to telework through at least June. And that's even more important now. So I just wanted to make sure that all the board members know that if you do come into the office, we expect you all to wear masks as well, unless you're in your office with your door closed. And this is not, it really isn't optional. If I could, Chair Escobar, I wanted to, out of order, just make one little observation on a completely different subject, which is with respect to the racial equity initiative of the boards. We had, this is a big week. We're having 4 external listening sessions, so inviting members of the public, of the community that we serve, our stakeholders, to come talk to us about how the board does its job and how the board can do its job better. And so we had the first session yesterday, and Chair Escobar, I believe that you gave the introductory remarks, and then we have sessions today, tomorrow, and Thursday, including tomorrow's session, which is going to be in Spanish. So we're doing what we can to encourage and accommodate the public to talk to us about how we do our jobs and how we can do it better. And this is just one of the first steps. We'll be having other opportunities for people, both our staff inside organization and hopefully for the outside community to talk to us too. So just wanted to make sure that everybody was aware of that and to really thank the board members who've all been very supportive and are going to help open some of these meetings, and to you, Chair Esquivel, for kicking off the first meeting we had yesterday.
Just thank you, Eileen, for the leadership around that work and all the incredible staff. You know, there is a steering committee of staff and a working group at this point that are all putting in hours and put in long hours last night. The last night's meeting was from 6 to 8 to accommodate folks that are working during the day. So we're not holding public listening sessions during working hours. Just the incredible commitment from our programs and our staff to the discussion has been really impressive. And just to your note, it's just these listening sessions are just a first moment. They're to gather input, to synthesize it, and so that it informs a resolution that we can adopt that isn't a resolution acknowledging what we all, I think, very, very commonly acknowledge, but instead, what are the actions that we're going to be taking to ensure that racial equity continues to be a lens in which that we see our work, because it is a lens that influences so much of the challenges that we find in the communities that we work with on these most pressing issues around water. And so just thank you. And I appreciate the flag, and it's related to COVID because, you know, not unlike, you know, and I was going to remark on the survey, what is incredible is we are all teleworking as an agency, as an institution, and able to still accomplish this incredible work, including a very critical discussion around racial equity. And it makes it a little more difficult because we can't have that conversation in a room with people, where it's easier to kind of read emotion and talk about one of the more sensitive things we could be talking about. But nonetheless, the discussion is critical and timely. And so just thank you for the emphasis on that. Any other thoughts or?
Chair Esquivel, I just wanted to point out that we did have one speaker card on the COVID item, and it's a speak if necessary for Ms. Tuck.
Yes. Look, good morning, Ms. Tuck. Good to see you.
Good morning, Chair Esquivel and members of the board. Cindy Tuck with the Association of California Water Agencies. Wanted to comment quickly about the surveys. It's great to start a morning with great news. So appreciate the report with that very positive news. And I just wanted to take a second to thank you, Chair Esquivel and Executive Director Sobek, for your support for the collaboration on the surveys. And then I wanted to thank board members Firestone and McGuire for their work with staff and the stakeholder group on the development of the surveys. It was a collaborative effort, and I'm thrilled that it was successful. Also, we greatly appreciated the webinar that was held after the survey for larger systems went out. There was great participation on that, with systems having a lot of questions, and that was very thorough and very helpful to members as they completed the survey. So thanks to everybody. And again, just wanted to note, we appreciate the collaboration.
Thank you so much, Ms. Tuck. You know, it has been a complete collaboration to get this done, and especially around the methodologies and the questions. You know, what do we ask that's appropriate and most reflects how a system operates? But you know, again, it's because of that feedback that we received that I think that we were so successful in being able to, and to say, you know, again, you know, methods wise, how many systems do we need to touch, where, and have confidence that we had that discussion, that criteria was built in, and we're not trying to, you know, just, you know, shotgun, you know, a survey, but really be strategic about it. Just thank you for that.
Thanks.
I'll just, sorry, I was just going to add, and I know you've, Aqua and other associations have been just so helpful in getting, you know, the participation of so many agencies in helping us craft the survey. It sounds like we still need another, I don't know, 20 or so that haven't responded yet, of the over 10,000 connections. So in addition to the ones that have responded and the ones that requested delay, I think we're still needing some. So just, you know, one last push with us all to try to get us over that amount. I think we, you know, we're all working hard to do that, and appreciate the effort to kind of finalize that last bit and make sure that folks can respond. So thanks.
Thank you.
Yeah, thank you, board member. And to your earlier comments, I think of the electronic annual report, our other data gathering activities that the board does. And I hope that this does help benefit those discussions as well, so that we can continue to, again, make sure we're always asking the right questions to get to the information that we're all, I think, in common. And this is the important part. The data gathering exercises we undertake feed the state discussion around these policies. And so they're pretty fundamental to help understand what we're doing. So just thank you, Ms. Tuck, for the continued engagement in those areas as well, as we talk about data streamlining and understanding how we best continue to do well by the data enterprise that we oversee. So thank you.
Great, thank you.
Well, I think that wraps up item number 2. And so just thanks again, everyone, for the incredible work around the survey. And again, to Director Sobek for flagging the work around the racial equity discussion as well. Next, then, we have a tranche of uncontested items. Items, I think, well, number 3 and 4, if I recall correctly. Yes. Any, Ms. Townsend, they still remain uncontested?
Yes, Chair.
I just want to, acknowledge before maybe a motion that great work, and these are really, critical items in of themselves. But we can, if there aren't any discussion around it, we can probably take them up.
No, thank you. I'll move for adoption of items 3 and 4.
I will gladly second these items, but before we move on, I just want to make a quick comment. And so I realize these are uncontested, but they're both incredibly important. They both are contracts that are going to help California build water resiliency in different ways. So item 3, it actually is a contract with the California Water Commission to provide staffing to assist with completing water right permit applications and petitions for the water storage investment program that came out of Proposition 1. And so this is a few years in the making now, since I think 2014. And so I'm just really encouraged here to see that level of support for what I know will be a lot of work still to come to really support these important water storage projects and really some quite innovative projects around the state. It looks like in dry times here again, and these are the types of projects that I think we need to see to help build long-term resiliency. I just also wanted to flag, though, that the augmentation of staff here, which is going to help quite a bit, does not make this a slam dunk by any stretch of the imagination. Our water right system, as we all know, is incredibly complex. These processes often involve detailed analyses, CEQA hearings in many cases, and they're not trivial, and they take time, and they take commitments from both our staff, which we will provide here, but also from the applicants themselves and from other stakeholders involved. And so this really will take, again, we've been talking a lot about collaborative efforts. These types of projects, often, sometimes controversial, do take collaboration to see them across the finish line in a reasonable time frame. So I just, really happy to see this today, and just noting that there's a lot of work still to come, and I hope to see that spirit continue. And then on item 4, this too is really important. This is a new contract for to help retain an expert panel for the direct potable reuse regulations, which again are going to really help with water supply augmentation for recycled water use around the state. Again, really innovative and important work. And I'm so happy to see this expert panel and the funding for it being made available. It's something that we didn't know maybe a year ago, whether the finances would be in place and able to help support retaining that expert panel, which is critical to staying on target for a December 2023 adoption of the regulations for direct potable reuse. So again, just great, really encouraged to see this. And that's all I really wanted to say today. So That is a very long-winded second.
Thank you. And here, board member, really, these two items are really critical for the resiliency work that we're doing. And just thank you for those comments. Ms. Townsend, can you please call the roll call vote?
Yes. Board Member Dodick.
Aye.
Board Member McGuire.
Aye.
Board Member Firestone.
Unfortunately, Board Member Firestone had to drop off because of computer problem. She'll be back on shortly, but we can go without her.
Vice Chair Diadamo.
Aye.
Chair Esquivel.
Aye.
Thank you.
Thank you as well. The vote carries, and the items number 3 and 4 are adopted. And thank you, all the great work to our folks in the program for actually doing the work to develop those agreements. And again, they're really critical. All right, that does bring us to item number 5. Well, we're only about 30 minutes in, but was gonna maybe take a short break if it's helpful for Board Member Firestone, or if Mr. Lawfer, you think I should just proceed?
Since this is a fairly important item, I would suggest going ahead and holding just a moment while she gets her computer restarted. So maybe take a 5 or 10 minute break.
Yeah, let's go ahead and take just a quick 10-minute break. We'll just give her enough time and say 3:40, we'll come back here. So we'll begin item number 5 at 9:40. Thank you.
This year we bought a sleigh, and it's got like presents hanging out of the sleigh. So we bought that this year and put our 3 white trees around that.
Ms. Cassidy, I apologize. We can hear the room.
Thank you.
All right. It is 9:40. I think we're ready to come back.
And bear with us for a second, Chair Esquivel. We want to make sure one thing on the Cali PA feed is going out correctly. Bear with us one moment.
Of course.
Okay, we're good to go.
Thank you so much. Welcome back, everyone. We're on to agenda item number 5. I have an opening statement to read. Agenda item number 5 is consideration of a proposed resolution establishing the water quality control plan for inland surface waters, enclosed bays, and estuaries of California and toxicity provisions. The State Water Resources Control Board is now considering the item. In accordance with the October 2nd notice, the board will consider, again, the adoption of the proposed resolution. This meeting is being recorded. If you intend to speak on this item, please follow the instructions on our website to fill out a virtual speaker card using the online form. The clerk will respond to your form with the password for the meeting. Time limits may be imposed on oral comments to allow all participants the opportunity to be heard. Most of the speakers requested 5 minutes or less, and some speakers have requested 10 minutes for oral comment. Those requests for 10 minutes are approved. We will now proceed with staff's presentation. Karen Mogus, our Deputy Director of the Division of Water Quality, will give the presentation. Thank you.
Thank you, Chair Esquivel. Can you hear me all right?
We can. Good morning.
Excellent. I'm so used to being at home. I'm in my office today, so I'm glad that things are working. Good morning. I wasn't sure if I was going to say morning or afternoon. Glad to say morning. Chair Esquivel and members of the board, I'm Karen Mogus, Deputy Director, Division of Water Quality here at the State Water Board. And I want to start off by introducing the team. First is Rebecca Fitzgerald. She's the supervisor of our Standards and Planning section in DWQ. She's on Zoom to help answer questions and support. Also on the Zoom meeting is Zane Paulson, our senior environmental scientist over the Freshwater Standards Unit and lead staff on this project. Rich Brewer is here. He's our environmental program manager that has provided both managerial and technical expertise to the project and much of the direction in terms of the number crunching and data analysis that appears in much of the staff report. And finally, we have Elizabeth Barrett, our attorney in the Office of Chief Counsel. I also want to acknowledge Jacob Iverson, Katie Fong, and John Wheeler, who have provided number crunching, research, and the lion's share of the heavy lifting to draft the staff report and the response to comments. And finally, I'd be remiss if I did not acknowledge the long line of staff who have worked on this project over the 17 years since the board directed staff to initiate this rulemaking. So starting off with our venerable Rick Rasmussen, who retired 3 years ago, Brian Ogg, Allison Buck-Boychuk, and Lorna McFarland. We used to joke that toxicity was the assignment you would get in order to encourage you to leave the water boards, which is of course not the case, and really glad to have the current team on board, but wouldn't have been able to get where we are without the prior staff. So just wanted to make that acknowledgement. It's been a long haul. So with that, next slide, please. I'm going to provide a really brief background. We've been before you a number of times, and so we'll just give a flyover view of where we've been and how we got to today. I'll talk about what the adopting resolution does. I'll give an overview of the toxicity provisions, and then summarize the main recent public comments and our responses to those. We also have 2 change sheets that I'll go over at the end of the presentation. Next slide, please. So this is our timeline from 2018 to the present. Of course, that's not 17 years ago, but 2018 marked the first draft of the provisions that was a statewide water quality control planning document. So we're marking that as the current effort. It was released in October of 2018. We held a hearing before the board in November of that same year and came back with a first revised draft, public review draft in July of 2019. Held a number of workshops after that and got direction from the board and did a number of other work to shore up our staff report, including adding 2 appendices that we released for public comment in December of 2019. Those were Appendix J, that gives an overview of the peer-reviewed publications related to the reliability of the Stereodaphnia test, as well as our staff data analysis of data being collected more recently than those publications. And Appendix K goes over the assessment of the lab capabilities to conduct the whole effluent toxicity testing in the timeframes that we have identified in the provisions. Finally, we released a second revised draft of the provisions this past July for another round of public comment, and that public comment period ended in August. We released the final proposed toxicity provisions along with all of the responses to comments on October 30th of this year, and here we are to hopefully convince you, the board, to adopt the provisions today. Next slide, please. This just goes over the longer time frame. We've held 2 board hearings over the 17 years we've been working on this 2 board workshops, 9 staff workshops, and 29 various stakeholder meetings to get input on the provisions. Next slide, please. And we've held a number, those 29 outreach meetings were held with a variety of stakeholders from environmental groups, water supply agencies, other regulatory agencies, non-point source discharger representatives, toxicity laboratories, recycled water dischargers, and of course, the POTWs and industrial discharges who will be most affected by the provisions. Next slide, please. So the adopting resolution will establish the inland surface waters, enclosed bays and estuaries water quality control plan and adopts the toxicity provisions as the first set of provisions that will be part of that plan. That plan will then incorporate all other freshwater discharge or freshwater water quality control plans, including trash, sediment quality objectives by bacteria and others that exist that will need to be incorporated administratively subsequent from this action. It approves and adopts the substitute environmental document, which is our staff report that serves both as a staff report as well as the CEQA document for the project. It provides some guidance for sampling and shipping coordination for dischargers who are remote in remote areas, maybe farther away from their laboratories than others that are in more urbanized areas, and directs staff to initiate a study to improve lab performance of the Cereodaphnia dubia method. I'm going to be using the shorthand of just Cereodaphnia for the rest of this presentation. And finally, direct staff to consider stormwater permit requirements as part of our state water board's strategy to optimize resource management of stormwater or STORMS program. Next slide, please. So a quick overview of what the toxicity provisions are. They establish numeric water quality objectives for chronic and acute toxicity. It establishes the test of significant toxicity as the statewide statistical approach for assessing aquatic toxicity test data for tests that use species identified in Table 1 of the provisions. So it's not universal, but covers most of the species that are being used today for regulatory purposes. The TST is a data analysis approach and not a change to the implementation of the whole effluent toxicity test methods that have been approved by US EPA. And finally, the provisions establish a program of implementation that's focused on non-stormwater NPDES discharges. Next slide, please. And so that program of implementation includes how to establish in-stream waste concentration. That is the basis for the effluent limitations that are established. How to conduct a species sensitivity screening to determine what species is used as part of the effluent limitations. How to analyze whether a discharge has reasonable potential and therefore requires effluent limitations, the aquatic toxicity monitoring requirements, including frequency for different sizes and types of discharges, effluent limitations, as I mentioned, targets, which are intended to work similarly as effluent limitations, but are not subject to violations. And then finally, how a discharger would proceed to conducting a toxicity reduction evaluation when toxicity is identified. Next slide, please. This is a list of the major categories of comments that we've received since the July 2020 draft was released. And I'll be going over each of these categories, so I won't list them here. Next slide, please. So starting with the appropriateness of using Cereodaphnia for compliance, we received a wide range of comments on the use of Cereodaphnia test method for compliance. Some commenters assert that the test is reliable and is already being used successfully for compliance with NPDES permits in California. Others request a delay in the statewide use of Stereodaphnia due to concerns with variability and the potential for false positives. Staff added Appendix J to the staff report to document both peer-reviewed published studies as well as staff's analysis of more recent data that demonstrate that most labs are capable of conducting the method with enough precision to achieve the false positive rates established for the TST. However, we do propose to conduct a study to evaluate ways that we could improve lab performance across all laboratories that are accredited in California for that specific method. Next slide, please. The study objectives will be developed through a stakeholder advisory group as well as an expert panel that we are forming as we speak. The first meeting of the stakeholder group is scheduled for next week on December 8th. And generally, the intent of this study is to investigate test conditions and factors that could be controlled or modified to improve lab performance of the Stereodaphnia method, and to evaluate consistent and comparable implementation of the test method across labs that are accredited in California. Next slide, please. The study is not intended to validate the method for use in California regulatory programs, nor is it a study to estimate false positive or false negative rates using the TST. Next slide, please. We also received a range of comments on the proposed delayed implementation of the Stereodaphnia method for compliance and permits. Commenters support the use of an effluent target rather than an effluent limitation in this interim period. Others propose that no effluent limitations using Stereodaphnia should be used until the study is complete. Still others assert that the delay in implementation is not necessary and that the delay doesn't comply with federal law. Staff proposed to conduct the study and delay statewide implementation of the Stereodaphnia monthly median effluent limitation, or MMEL, until January 1st, 2024, as long as it is consistent with federal law, which must be a determination that's made on a permit by permit basis. Next slide, please. So the delayed statewide implementation of using Stereodaphnia for compliance includes 4 scenarios for permits that are issued, reissued, renewed, or reopened to address toxicity after the effective date of the provisions and through December 31st, 2023. And these scenarios include a combination of the maximum daily effluent limitation, the monthly median effluent limitation, and the monthly median effluent target. Starting January 1st, 2024, the non-stormwater NPDES dischargers must comply with the MMEL using Stereodaphnia when Stereodaphnia is identified as the most sensitive species. And for permits that are issued, reissued, renewed, or reopened on or after January 1st, 2024, the permitting authority shall include the maximum daily and monthly median effluent limitations using the most sensitive species, even if it is Stereodaphnia. Next slide, please. This is the table that appears both in the staff report and then in narrative form in the provisions. It has been updated to indicate that for scenarios 3 and 4, the existing effluent limitations and permits do not need to be based on Stereodaphnia. And I will mention this again when I talk about the change sheets later. For scenario 3, the Regional Water Board may consider laboratory control data when determining whether or not to include the MMEL for Stereodaphnia. For example, the Regional Water Board may compare lab control performance data to data from laboratories currently meeting the false positive rate in Appendix J of the staff report. For option B, the MMEL must be included using green algae or the fathead minnow. And note that the MMEL using Stereodaphnia may need to be included to comply with federal law, both for scenarios 1 and 3. I suppose I should have walked through all of this, but I think I've done it a number of times and we know what the various scenarios are. So next slide, please. We can come back to this if necessary. Moving on to provisions related to superseding or not superseding TMDLs, commenters were concerned that the provisions would supersede TMDL requirements that had been adopted by the regional boards in the public process. And so it was not our intent to supersede TMDL requirements. So we added language to clarify that TMDLs are not superseded and that TMDL requirements that are more protective than the provisions requirements will apply in lieu of the provisions. That does not preclude regional boards to apply the provisions for compliance for existing TMDLs if they deem that necessary as well. Next slide, please. Commenters indicate that the requirement to have a pretreatment program does not indicate risk for toxicity and that the definition of a pretreatment program was unclear. This is related to the requirement that POTWs that discharge greater than 5 mgd and are required to have a pretreatment program will automatically receive effluent limitations for aquatic toxicity. Staff clarified that pretreatment programs are those required by federal regulations, and we continue to support the use of the 5 mgd threshold and requirement for a pretreatment program as appropriate for requiring effluent limitations without the need for a reasonable potential analysis. Toxicity tests are a backstop that allows us to measure toxicity from chemicals we don't measure or mixtures of chemicals. The larger the discharge and more diverse the sources of influent, increase the complexity of the discharge and potential for toxicity to occur. And I'm sure we will talk more about that later. Next slide, please. We also received comments about the required toxicity monitoring. Some commenters assert that the minimum frequency should be quarterly rather than what is currently proposed, which is 2 tests annually, as the fewer tests leave gaps in information about the toxicity of the discharge over the year. Some commenters also proposed that options for a regional board to reduce monitoring frequency should only be available to dischargers without any fails of the TST in 5 years, as opposed to the less stringent current proposal of using violations within the last 5 years. And we do not propose any changes related as a result of any of these comments. Next slide, please. As you all know, we added this term targets, the maximum daily effluent target and the monthly median effluent target for dischargers who do not have reasonable potential, but will be required to conduct toxicity monitoring. This was added in response to comments from regional boards who indicated that even for dischargers without effluent limitations, they would require toxicity monitoring. So in order to ensure that that toxicity monitoring is conducted consistently among all dischargers and results in a TRE appropriately, even without effluent limitations, so we can identify what's causing toxicity, we added effluent targets. Some commenters assert that the POTWs without reasonable potential and therefore no effluent limitations should not be required to conduct toxicity monitoring and be subject to the MMET and MDET requirements. And staff is not proposing any changes to this based on the comments. Next slide, please. We continue to get lots of comments, concerns about being able to conduct the monthly median effluent limitation routine and compliance monitoring within a calendar month, and that it's infeasible. And there are some proposals to allow for the potential third test to be the routine monitoring test for the subsequent calendar month. We do have a change sheet that we have proposed that clarifies the requirements for the MMEL testing for dischargers that have less than a monthly monitoring requirement. And I'll go over that when I get to the change sheet. But in terms of the general concept of conducting the monthly median effluent limitation required monitoring within a calendar month, and that is initiating the test within a calendar month, we've not proposed any changes to that. Next slide, please. These are some other notable changes that bring us back to the version in 2018 that I just wanted to highlight, that shows some additional flexibility that we've provided as a result of comments that we received. Our current provisions leave the requirement to conduct acute toxicity, reasonable potential, and monitoring requirements up to the regional board's discretion. Previous versions of the provisions required acute toxicity assessment for industrial dischargers in particular. So we have removed that requirement and left all of the acute toxicity to the discretion of the regional boards. We now allow data from the prior 10 years to be used for species sensitivity screening upon approval upon the effective date of the provisions. Previous versions only allowed the prior 5 years to be used of data. We now allow for the species sensitivity screening to be conducted once every 15 years. Previously, it was once every 5 years, unless you were participating in a regional monitoring program, which was the issue that we addressed. We now require a minimum of 2 toxicity tests annually for dischargers less than 1 MGD. Previously, it was 4 tests annually. Intermittent dischargers may conduct fewer than 4 tests for species sensitivity screening if they are not discharging in every quarter of the year. Previously, it was 4 tests regardless of when they discharge. Our current proposal allows for MMEL compliance tests to be initiated late under certain circumstances that are beyond the discharger's control. That was not clear in previous versions of the provisions. And as I already mentioned, our current version delays the MMEL for Cereodaphnia to January 1, 2024 for certain dischargers. Previous versions implemented all effluent limits upon effective date of the provisions. And finally, the current provisions allow for exemptions for pesticides, drinking water, and hydrostatic testing dischargers provide exemptions for those types of dischargers from the provisions where previously those exemptions were not included. Next slide, please. Okay, so now I'll move on to the recent changes that are reflected in the change sheets number 1 and number 2 that were released over the last few days. Recent comments identified, and I'm going to start with the change sheets that are related to the provisions, then I'll move on to the staff report, and finally the change sheet related to the resolution. So they appear in different combinations in change sheets 1 and 2. So starting with the provisions, recent comments identified an unintentional inconsistency with the state implementation policy as it relates to applying dilution credits for dischargers. The sentence that you see deleted here limited the ability of regional boards to grant a dilution credit to intermittent or seasonal dischargers. This is not consistent with the state implementation policy, so we propose to delete this sentence so that we are consistent with the direction in the SIP regarding dilution credits and mixing zones, which was our intent all along. Next slide, please. We revised section 3B3, interaction of toxicity provisions with basin plans and the state implementation policy, so that we are using the same terms to refer to the same thing. So this is a non-substantive change that is for consistency and for clarity. So we changed provisions to requirements when referring to TMDLs. Next slide, please. We revised section 4B. I think I'm missing a slide. Apologies. We revised section 4B2E2 for the permit issuance, reissuance, or reopening that occurs on or after January 1st, 2024 to make it clear that those permits must include the maximum daily and monthly median effluent limitations as indicated in section 4B2E4. Next slide, please. This is the one I kept expecting to see. We revised section 4B2C to clarify when additional routine monitoring is required for dischargers with monitoring frequency of less than monthly. For dischargers with quarterly or fewer tests required annually, when there is a single violation in a calendar month, an additional routine monitoring test must be initiated in the following calendar month to determine whether a TRE is required. So this is an additional routine monitoring that isn't otherwise required except for the fact that there was a violation in the first calendar month. So to allow for flexibility in initiating this additional routine monitoring test, we've added language to require the routine monitoring test for the next calendar month be initiated within 2 weeks after the calendar month in which the first violation occurred. So if you think about the requirement for quarterly monitoring, there's more flexibility than those with monthly monitoring so that the calendar months don't overlap. And so this just provides clarification that we expect the next test to be initiated relatively quickly, but not in the successive calendar month, which implies immediately upon the next calendar month initiating. So this gives a little bit more flexibility for the dischargers with less than monthly monitoring requirements. Next slide, please. And similarly, this language was added for the targets as well. Next slide, please. Moving on to the change sheet related to the resolution, we inserted a new recital in the resolution to make it clear that the provisions require the toxicity test be conducted in accordance with EPA approved test methods, including the parts of the methods that address and prevent laboratory or other interference that may result from low dissolved oxygen, suspended solids or dissolved solids, or extremes in pH, hardness, or salinity. We received a number of comments related to how the methods should be, requesting that we include detail about how the methods should be implemented in the provisions. And we're reticent to include that for a number of reasons. The main one being that if EPA changes their methods, then we have to go back and change our provisions, which is not what we intend. So this is to make clear in the resolution that we're pointing to EPA's methods for implementation and all of the guidance for addressing lab interference that the methods allow for. Next slide, please. This change in the resolution is intended to identify possible regulatory outcomes from the findings of the Stereodaphnia study, including guidance to laboratories or possible regulations that would apply to all labs accredited to conduct the Stereodaphnia method for regulatory programs in California. This is related to concerns we heard that the study would not be used for any regulatory purposes moving forward, and wanted to clarify that there may be a couple of potential outcomes. There may be others that aren't listed here, but we will see when we bring the study results back to the board in 2023. Next slide, please. As I noted in slide 15, table 5-3 in the staff report was modified to be consistent with the intent that scenarios 3 and 4 during the while we're conducting the Stereodaphnia study may apply to permits with numeric effluent limits, current numeric effluent limits, regardless of the most sensitive species. So the next slide shows the deletion of Stereodaphnia as the most sensitive species noted in both scenarios 3 and 4. So I wanted to make sure that that was clear and consistent with the provisions. Next slide. And finally, our staff recommendation to the board is to adopt the proposed resolution, including change sheets number 1 and number 2. And with that, that's the end of our staff presentation, and we welcome any questions before public comment or after.
Thank you so much, Ms. Mogus. I know this has been an incredible and long effort, decadal in the making. And so just want to acknowledge again the good work that has gone on in the program to get us to this point. And that includes the collaboration with so many of the dischargers, wastewater treatment plants, and others in this discussion to figure out how we best strengthen this last line of defense to pollutants that we don't understand or know, but still create toxicity in our waterways. And just thank you for, I know the good work that's gone on and the confidence I hope ultimately from our dischargers in the program. So with that, I don't know if there is anything my fellow board members have questions on currently, and by all means can chime in now, and then otherwise we can move to our first panel.
I just thank you for the presentation. Appreciate that and walking us through all the changes. I just have a clarifying question on slide 25, where you in the change sheet are proposing to provide additional flexibility for the routine monitoring. I appreciate the flexibility that you're adding there with the additional 2 weeks. Although it's a little hard to keep track of everything in terms of what's required when. And so just so I understand, so if there is a violation in the first month of routine monitoring, that triggers then a second month of routine monitoring. And that party has an additional 2 weeks, for example, to take that sample. Would they then be subject to a 30-day window to complete additional compliance tests? Or would that be within the same calendar month?
So we're only talking about dischargers that don't have monthly monitoring.
Right.
So they wouldn't otherwise be required to conduct another routine monitoring test in the subsequent month. So we are continuing to require all monthly median effluent limitation routine and compliance tests be initiated within a calendar month. What the new language provides is 2 weeks of sort of flexibility in initiating the next calendar month within that quarter to determine if a TRE is needed. And that calendar month would begin upon initiation of that test, and they would still have to conduct whatever effluent, whatever routine and compliance monitoring tests would be needed to assess compliance with an MMEL in that second calendar month. But it gives that 2 weeks flexibility for dischargers who don't already have to do a routine monitoring test in that next calendar month because they have fewer than monthly requirements.
Okay, thank you. That's helpful. I think you answered my question saying the calendar month begins when they take that next month's routine monitoring test.
That's correct.
That's what I was
so it does provide that, it truly does provide that 2 week of flexibility for those.
Okay. Thank you very much.
You're welcome.
I had a clarifying question unless other board members do. So just to clarify, we're now allowing for where, and I think this is scenario 3, but I just want to make sure, we're allowing where dischargers already have a permit with effluent limitations where C. dubia is the identified sensitive species. So they are already required to do this and have been. We're now saying that they no longer are subject to those numeric effluent limitations during the study. Is that correct, or am I misunderstanding?
So I'll just walk back and explain scenario 3, and you can ask me where I've not made it clear enough. So scenario 3 is for dischargers who currently have numeric effluent limitations for aquatic toxicity in their permits. regardless of what the species is. So it does not have to be Cereodaphnia. And they have two choices. They either, if Cereodaphnia is the most sensitive species in their next species sensitivity screening, they can either implement the MDEL and MMEL as required by the provisions. So no interim difference during the study. Or 3B allows for implementation of the maximum daily effluent limitation for Cereodaphnia, a monthly median effluent target for Cereodaphnia, so that the monthly median would not result in a violation for Cereodaphnia under 3B, but then they would have to conduct toxicity monitoring with another species that they would then get the monthly median effluent limitation for that other species. So it might be the algae or the fathead minnow for freshwater.
And can you just walk through again the reasoning for why we would move to a target and have a different species where it's already in that, basically scenario 3B? What's the basis to make that, or I guess it's allowing that change?
Yeah, so the basis is really to allow for dischargers who already have numeric effluent limitations to be afforded some relief due to the lack of confidence that many stakeholders have expressed in the Cereodaphnia method.
Okay, and allowing us to do the study, be able to maybe provide recommendations for how test reliability can be improved and allowed to have more certainty. That's okay, great.
Yeah, and the choice, and to be clear, the choice between 3A and 3B is up to the discretion of the regional board.
Okay, so a regional board could say, we just are going to keep our effluent limitations and not allow that change.
Yeah, and one justification that we've included for making that choice is that if the current lab doing the testing for the discharger is achieving the precision necessary, then there's really may not be a reason to not implement the effluent limitations as stated.
Okay, that's really helpful. Thanks.
Mm-hmm.
Good questions. Thank you, board members. Not hearing any further question, then we can move to the first panel that we have, which I'm seeing here will consist of Annalisa Moe from Heal the Bay, Caitlin Kalua from the California Coastkeeper Alliance, and Paul Bador. Oh no, sorry, Paul is part of panel 2. I apologize.
Correct. And both Annalisa and Caitlin should at this point in time have control over their microphones so they can hand off their presentation between each other.
Great. Thank you, Mr. Loffer.
Excellent.
Good morning to you both.
Good morning. Oh, wonderful. There's our PowerPoint. That was my next question. All right. Well, thank you, everyone. I'll kick off our joint presentation this morning. My name is Caitlin Kalua. I am the policy manager with California Coastkeeper Alliance, which represents local waterkeeper organizations throughout the state. And with me today is Annalisa Moe, water quality scientist with Heal the Bay. Next slide, please. So these provisions have been in development for nearly 2 decades. As already been discussed this morning, is quite a Herculean feat by your staff and many others to actually get us to our point today. And since this process began in 2003, a number of concessions have been made, including but not limited to the exclusion of stormwater discharges, reducing the frequency of species sensitivity screenings, and now the delaying the use of Cereodaphnia dubia for compliance. I would like to also note, just based on today's staff presentation, that now we also have this flexible 30-day period for MMEL compliance that I know has received quite a bit of pushback and concern, but just want to also flag that this monthly median testing using 3 tests within a calendar month has been used successfully for believe nearly 2 decades during this time, particularly in smaller states such as Arizona, where their dischargers have been able to appropriately meet that 30-day timeline. So I just want to flag that as we move on in today's hearing. Despite these concessions, we do support today's hopeful adoption today, given the long and arduous 17 years that it's taken to get here, and recognizing essentially that this is a needed backstop for monitoring and detecting toxicity for those chemicals and other sources of toxicities that we don't otherwise directly monitor and sample for. Next slide, please. Stormwater and agricultural discharges are known sources of toxicity in California. This is especially true for industrial stormwater discharges, which comprise of highly hazardous chemicals, heavy metals, and grease. The Clean Water Act requires that stormwater specifically shall not adversely impact human health or the environment, and shall not cause or contribute to an exceedance of any applicable water quality standard. Essentially, we encourage that the provisions be applied to all discharges, including stormwater, agricultural, and other non-point dischargers that have the reasonable potential to cause and contribute to toxicity. At a minimum, these provisions should be incorporated into all industrial stormwater permits. For those discharges that do not fall under the scope of today's provisions, we do ask that staff provide a clear path forward to address toxicity requirements consistently for these discharges in the future. And next slide, please. And of course, our favorite water flea, Statewide dubia. We do encourage that the State Water Board do not delay nor prevent dischargers from using Statewide dubia to determine compliance where it has been identified as the most sensitive species. Essentially, Statewide dubia is the only freshwater invertebrate species used to test toxicity, and requiring an MDEL rather than a MMEL is essentially not protective of chronic long-term effects of toxicity. A daily limit simply is not protective for chronic toxicity. And as already acknowledged by staff and in the staff report, Statewide dubia for chronic toxicity is a reliable test and is already being used with success as the most sensitive species in a number of existing NPDES permits in California. Recent peer-reviewed and scientific literature support the use of Statewide dubia, and as well as the State Water Board staff's independent review also demonstrates that there's confidence in performing this test in California and that there is no need to delay the use of Statewide for compliance other than to improve a perceived public lack of confidence in this test. We strongly recommend that Statewide dubia be used to determine MMEL compliance, and specifically looking at page 3 of change sheet number 1, do suggest and encourage striking the option B under scenario 3, that those with existing Statewide dubia requirements maintain those requirements through the study period. Again, these dischargers have successfully used the species, and there's no reason to roll back that potential requirement. Next slide, and I'll switch to my co-panelist. Thank you.
Thanks, Caitlin. And I think we can actually go to the next slide. All right. Thank you. Good morning, board members and staff. For the record, my name is Annalisa Mullen with Heal the Bay. And I'm just going to go through some of our remaining recommendations on the provisions this morning. So the District Board has set an appropriate and protective reasonable potential threshold as any toxicity test that results in a fail, or if the percent effect at the IWC is greater than 10% for both chronic and acute toxicity. Anything less will fail to meet the overarching goals of the toxicity provisions. However, new changes to the discharge volume threshold are not needed. We recognize that all POTWs in California larger than 5 mgd are required by state law to have a pretreatment program, but the inclusion of this language is simply unnecessary. Due to the sheer volume of the discharge, any facility that discharges greater than 5 mgd should automatically be assigned reasonable potential with the requirement to comply with monitoring requirements and toxicity effluent limits. Next slide, please. Monthly monitoring is needed to provide an accurate depiction of a discharger's current potential for toxicity. If routine monitoring is not conducted monthly, routine monitoring should be required to take place quarterly at a minimum to capture seasonal variation in the effluent as a backstop against the additive and synergistic effects of known and unknown pollutants that may be present at different times of the year. This is especially important for the effluent-dominated rivers and streams in California, where discharges less than 5 mgd can be the dominant source of flow in the waterway. Any monitoring frequency reduction should only apply during dry weather months for a commingled system or stormwater discharge. Routine monitoring should also be done during a singular storm or first flush event following dry periods. Next slide, please. Any sample taken under the permit, including monitoring during a TRE, must be reported and may be used to determine compliance. We respectfully request reporting requirements, including reporting to CIWQS, be explicit in provisions when a regional board allows a temporary reduction of routine monitoring during a TRE. And this is to ensure public transparency and accountability. Next slide, please. Onto species sensitivity screening. So this species sensitivity screening is a key tool to determine the most sensitive and thereby the most appropriate test species for toxicity monitoring and compliance. And this even reduces costs for dischargers by only requiring monitoring and testing against a single species. Species sensitivity screening generally occurs every 5 years with a new permit cycle to capture any changes in the character or volume of the effluent, with limited exceptions. Extending species sensitivity screening beyond this 5-year period is unnecessary and will prevent the water boards from properly regulating the toxic effect of contaminants of emerging concern and other unknown chemical compounds and interactions that may arise in effluent over a 5-year period. So where a species sensitivity screening is not required, toxicity monitoring requirements should use a multi-species test or otherwise be determined by the regional board based on specific environmental factors and specific characteristics of the discharge. Finally, we do support the removal of the exemption of species sensitivity screening for chronic toxicity for those who participate in a regional monitoring program. Next slide. We do support the removal of the small disadvantaged communities exemption, given all communities, regardless of their socioeconomic status, should be entitled to an equally non-toxic environment. We respectfully request that the State Board include explicit resolution language outlining the resources available under the Department of Financial Assistance and explicitly commit to providing communities in need with direct financial assistance to comply with the toxicity provisions. The provisions remain unclear regarding the exception for insignificant dischargers, as there is no clear criteria for what constitutes a very low threat. Given that even small discharges can have a significant effect on ecological health, we ask that the board direct staff to clarify what constitutes a very low threat to water quality and provide clear criteria for regional boards to evaluate when making such determinations. Finally, to ensure statewide consistency and regulation of both known and unknown toxicants, the newly added exemptions for biological and residual pesticides, drinking water, and natural gas facilities should be removed. Next slide, please. So finally, in summary, we do support the adoption of the toxicity provisions today as a needed step to apply consistent numeric toxicity requirements statewide. But we strongly urge the board to consider the recommendations outlined in this presentation to strengthen these provisions for the sake of public and environmental health. We also encourage the water boards to track the efficacy of these permits on more than simply just cost. We encourage the board to track the number of toxicity test fails, the cause of toxicity, and how long it takes for dischargers to return to compliance, where aquatic toxicity exceedances are occurring, and improvements or stagnation of receiving water quality for aquatic toxicity. Additionally, we urge you to consider metrics that can inform lab accreditation to keep statistical analysis separate from issues of laboratory performance. Thank you very much. And with that, I think Caitlin and I are both available if you have any questions.
Great, thank you both. Anything fellow board members want to flag now and or have questions for folks?
I have some questions. I can't tell if other board members, so these are actually questions for staff just to clarify around some of the issues brought up. One question is just on the data collection for TRE reporting. What is the requirement around that? And can you clarify why that is?
So routine monitoring can be reduced during a TRE, assuming that toxicity monitoring is being conducted as part of the TRE. That reduction can be done, and I'm hoping that Zane is on and listening because he's going to need to correct me if I misspeak. But that reduction can be either during the TRE or 1 year long, whichever is shorter. And any toxicity tests conducted at the in-stream waste concentration using the most sensitive species will be used for compliance with the effluent limitations. And either Elizabeth and Zane, I don't see either of their videos coming on, so I must have gotten it right.
So I guess for the, as we're waiting, in case somebody's corrected, so maybe this is sort of back, I don't know, Annalisa, or just to clarify, is there, so what data collection do you understand is not reported within that then? I'm just trying to understand that concern.
Caitlin, you can jump in too here, but we just want to ensure that all of this is reported, particularly to the SWRCB website, for the sake of transparency and making sure that it's there and that it is used to determine compliance even during a TRE where we understand that they are, attempting to address whatever toxicity is already there.
And jumping in, I can pull up the actual provisions language in a moment, but I believe when we were looking at this, that was the piece that maybe just wasn't explicit as we were reviewing the comments. And so just ensuring that not only for during TRE, but in routine monitoring, but essentially all data that is sampled and collected, that even if it's beyond the permit requirements, that it's still being uploaded to SWRCB.
Great. So Karen or somebody else. So so the intent is to require that? Yeah.
Yes, the intent is to require, and a TRE is required under our regulatory provisions. And so I guess it's assumed that they are also required to submit the data.
Okay.
Rebecca, did you want to add anything? I'm sorry.
Yeah, hi, sorry to interrupt Board Member Firestone. I just wanted to add that we went through kind of a bit of an exercise just to make sure that all of the monitoring reports that are collected when they're doing toxicity testing are able to be submitted into our SWRCB database, and they are. So that's a pretty standard course of practice for us. And I think, as you all know, those data are publicly available. So that made us pretty confident in that being the mechanism for making sure we have the data that we need.
Great. Okay, thank you for that clarification.
Yeah, thank you.
I have another question on this. It's just, and again, I think this is with staff just to help clarify a point that was brought up. So for the dischargers above 5 MGD who do not have a pretreatment requirement, I'm just a little confused about who that applies to, how often that is, and then what the reasoning is to not require effluent limitation.
So it's not that they aren't required to have an effluent limitation. They're not required to conduct reasonable potential. Okay, let me step back.
Right.
For dischargers greater than 5 MGD who are required to have a pretreatment program, do not conduct a reasonable potential analysis and automatically get an effluent limitation for aquatic toxicity.
Yeah.
The ones that are left do reasonable potential, and if they have reasonable potential, will get an effluent limitation according to the provisions.
Okay.
So it's not that they don't get effluent limits, they just do the analysis first.
Okay.
Correct.
And just so I understand, and so is the reasoning behind that is that the types of chemicals that are in effluent are less likely to be toxic? I guess I'm just, in terms of the reasoning around that, can you just help clarify why that is?
Yeah, so a pretreatment program is intended to apply to dischargers who have a variety of industrial inputs to their system. And so there are criteria in the federal regs associated with, what a discharger, what requirement or what criteria would be applied to determine whether or not, and 5 MGD is one of those criteria, but not the sole criteria. So we added that a pretreatment program would be required to incorporate those other criteria that are used to determine whether a pretreatment program is necessary and therefore the increased risk. What adding that pretreatment program to the 5 MGD threshold did was kind of dropped out a few of the dischargers that, while they are permitted at 5 MGD, they probably aren't discharging at 5 MGD on a regular basis or ever. And so they may not even exceed that threshold of discharge anyway. And then of course, they don't meet other criteria that would require them to have a pretreatment program. So we think that it's appropriate that those may have less risk, and they already have pretty conservative, reasonable potential to analysis to go through. So they may get effluent limitations anyway.
Right. Okay, great. Last question that I had, and this may be, this is more general, but stepping back, I know it was brought up around, stormwater is not applying to stormwater or other non-point source. So can you just clarify what are there portions of this that do apply for industrial or other stormwater dischargers that can you just clarify which portions do, if there are?
Sure. So any dischargers that NPDES dischargers for stormwater or other non-point source dischargers that have toxicity monitoring requirements already in their permits will have to comply with the requirement to conduct use the TST as the statistical approach and report the data as indicated in the provisions to whichever database is appropriate, CWIC, SMARTS, whatever. Sorry, let me make sure I get this right. And so the water quality objectives apply to all discharges. It applies to our assessment of ambient data as well for our integrated report. So what doesn't apply are the very specific implementation requirements that are currently specific for non-stormwater NPDES dischargers. So we acknowledge that there is a need for those specifics to be applied to stormwater, but that might be another 17-year project. And so we're going to be chipping away at those permitting issues as part of our storms program, which is why we included the resolution language pointing us to the storms program as the venue where we would need to really wrestle with those things and potentially amend the toxicity provisions in the future to include implementation requirements for stormwater dischargers as well.
And just on that, just to that sort of last point, so for things like industrial stormwater permits, is there ability to create more specific, one specific to more specific implementation requirements specific to those permits without having to go through the amending this policy? Or can that not be done now in individual or sort of these general permit requirements?
No, it's up to the discretion of the permitting authority on a permit by permit basis. So what we lose with that is the consistent application across permits, but there's no restrictions on including these types of requirements in permits, permit by permit at this point.
Okay. Okay, great. Thank you. That's all the questions I have.
Okay.
Thank you. Much appreciated, board member. I think next we have our second panel now, which is,
I'm sorry.
Oh, sorry, board member Doda.
At the end of the presentation, I believe it was Ms. Mo who went through some metrics that you proposed we track and measure, and you went through it fairly quickly. So if I could ask you to take a moment and perhaps go through them again. And then I'd like to hear from Ms. Mogis if these are metrics that staff has considered, and if so, what does staff have in mind in terms of, because I gave you the heads up at the last board meeting that I would be asking for some sort of effort to track result implementation, which include costs, yes, but I also want to know how are we going to track the effectiveness of these provisions. So if you could first of all repeat the recommended metrics you have, and then I'll ask that Ms. Mogis respond.
Yeah, definitely happy to go through those again. So the metrics that we are proposing to follow are the number of toxicity test fails that are reported, the cause of that toxicity, and also how long it takes for the dischargers to return to compliance. In addition, where this aquatic toxicity exceedances are occurring, potentially like the map or something like that, and then improvements or stagnation of receiving water quality for aquatic toxicity, so trends over time. And then our last note was just to see what statistical metrics might help to inform the lab accreditation program to make sure that we're keeping statistical analysis separate from issues of lab performance.
Thank you. Oh, it's helpful. Ms. Mogis, any idea at this point in terms of whether it's feasible to track those data points, and if, you know, we have the resources to do so, what do we need in order to collect this information?
Well, as luck would have it, TST makes it a lot more simple to track some of this information, so that's good. Certainly, number of fails, numbers of violations, numbers of TREs conducted, numbers of successful TREs, and that get to a cause that then ultimately get to return to compliance and addressing the cause. I think all of those things are ones that we could track. Maps, I think back to the toxicity report that we put together back, I want to say 2011, 2012, in support of the policy being developed at the time, where we looked at the rates of fails and toxicity and the magnitude of that toxicity across the state, both for ambient as well as, well, mostly it was receiving water. So we could commit to doing a periodic review of the toxicity monitoring data across the state as part of our integrated report process, something like that. I'm a bit talking off the top of my head, although I started writing my list, and as Annalisa started talking, her list was exactly the same as my list. So I think we're on the same page. And maybe as part of our report back on the Cereodaphnia study, we could also report back on some metrics that we've started to track and a proposal for long-term tracking of those metrics for the provisions.
So I just want to jump in and say with toxicity, it's a little bit harder to determine return to compliance, since these are episodic events usually. And so you may determine a cause that you can fix that does it. Sometimes you determine a cause, but it's not a ongoing cause. You know, if you have a spike in ammonia or a spike in some toxic contaminant, there may be nothing to do to return it to compliance except to look at your pretreatment program and over time see if it reappears. So I think we're going to have some discussion on what it means to say return to compliance for it.
Yeah, and perhaps in the development of some of these metrics that we would be tracking, it can be a bit of a discussion with folks to kind of zero in on with the stakeholders what may be there. And we just flag to Ms. Fitzgerald's comment that thankfully I think at least at the front end of a lot of the development of this, making sure that it is being reported and going through the reporting requirements and making sure that it is going into CWICs, it will lend itself to us being able to then have these follow-on analytical sort of glosses on the data coming in. And just want to thank the good work I think at the front end that is going to prepare us for maybe again some of these metric discussions further down. But we'll be collecting the data. I'm pretty confident here, and can then have those follow-on analytic sort of side of things discussion.
And we will review what elements we have in CWICs and what elements need to be enhanced, because I'm not sure that we have things like the results of a TRE in a data element as opposed to in a report on the TRE. Right. And so looking at those items may require some changes and some updates to CWICs, which will delay things a little bit, but we'll look into it.
Appreciate that. Thank you. Vice Chair.
Thank you. This is a really good discussion, and I had been kind of mulling over the issue of whether or not to request a report in addition to when we hear about the results from the study. And I think that I just really want to thank the commenters for their good suggestions, kind of helping us hone in on things that we should be looking at. And I agree with Mr. Bishop. I think it's better to hear from staff about, what's really doable here. And just want to put in a pin also on the issue of cost of compliance. I don't have any, we've got the storms project that we're looking at as sort of a model for guidance, looking at these issues going forward, but that's in the adoption of provisions. And so with a lot of ongoing concern about the cost, the lab costs, especially in, remote areas where they really don't know if they're going to be able to get these tests within a certain amount of time. I would just request, Mr. Bishop, that you also, when you report back, that you look at and how you could also report back on the issue of implementation with cost without it turning into a massive project where we're, resource constrained. So just really looking for your guidance to report back on some of the concerns that I know we'll hear from stakeholders about cost.
And we will do that. We are also in the process of applying to EPA for an alternate test method, which will allow folks to use less replicates if they choose, to reduce the cost of the monitoring.
Great, thank you both.
Just to clarify on the ATP, it would be reducing the number of concentrations, not necessarily the number of replicates.
That's exactly a more correct way of saying it.
Yeah. Thank you so much for that.
If I could just add, I definitely support this discussion. Very good over metrics and tracking going forward. I think that's incredibly important, and this will be value added to what we're moving forward with here today, potentially. And I just want to also emphasize, I think that discussion about continued evolving understanding of baseline ambient conditions is really important. I mean, we're talking about a lot of just non-point source dischargers. It's going to take, a long time to even understand what that world is. And I think, when we talk about concepts like cost of compliance, to me, it's also, let's not throw good money after bad. I mean, if we should understand, whether it's through the integrated report process or just a kind of a focused report here on toxicity that's present in our waterways, I think it's just really essential to understand, where are we discharging now? What is that current status? And, has that changed over time since we last took a holistic look? So just wanted to flag that as I think an important piece of this work going forward. And then also just a question to staff. One of the comments that was raised was on the requesting criteria on insignificant dischargers. And so I was just wondering if you could refresh my memory on, are there criteria now in the provisions as proposed? How is that decision being made as to what's an insignificant discharger?
I'm assuming that was a question for me.
Yes.
And we intentionally did not provide a lot of specific criteria for what an insignificant discharger is, although I'm hoping that one of either Elizabeth or Zane can point me to staff report discussion of it, because that could, could be extremely controversial and difficult to do on a statewide basis. So we left it up to the regional board discretion to make findings as to why they would consider a discharge insignificant, whether that be volume or the receiving water amount of dilution, that it would be up to the regional board to make that determination and utilize that exemption for certain of their dischargers. So an example might be utility vault discharges that are pretty de minimis in terms of toxicity. That might be one example. And I think we may have provided a number of other examples in the staff report, but I don't have it right at hand. Maybe I can grab that and return to the question.
If you could, yeah, just let me know where that is in the report when you get a chance.
Will do.
Thank you.
Thank you, board members, for the good discussion. And thank you, panelists, for engaging us in that discussion. Really appreciate it. I think we're ready to move on to our second panel here, which is a panel of one with Paul Bador.
Good morning.
Good morning. Good morning.
Here. It's great to see all of the board members.
As well.
I want to thank you for the opportunity that you've given me and my colleagues to meet with you individually the past few weeks to provide comments on behalf of what you see on here, the 7 municipal agencies here in the Central Valley that fund our efforts. And today I'm just going to provide a recap of our final 2 comments, our final 2 requests following our good conversations with you. And we'll start out with Cereodaphnia. So if you could go ahead and advance the slide, please. So what I want to recap here is just the outcome of 3 different studies. In these studies, what they did was to report out testing with the chronic Cereodaphnia test on blank samples. And what you can see from these 3 studies, from the US EPA data collected for study 2 all the way to study 1 here, was data collected recently from California-based labs, that between 14 and 43% of the time in these studies, the labs are coming back reporting that these blank samples without any pollutants in them are determined to be toxic with the Cereodaphnia test. And so from information like this, we can conclude that there are test-related issues that cause blank samples to be declared toxic. And why this is a concern to the discharger community is that the same test issues that can result in test failures or toxicity observed on blank samples could also affect the outcome of their compliance samples, which brings us to the next slide, please, which is information on actual discharge samples. So here I'm summarizing for you the outcome of 17 different split tests on discharge samples from POTWs in the Central Valley. This data was compiled for the Civiqua low-level toxicity special project. And here on the right in the chart that summarizes this data, let's just focus for time purposes on the bar in the middle, which indicates that in 7 of these 17 split tests on discharge samples, 1 lab is coming back communicating that the sample is not toxic. There's no problem with the discharge to be addressed. While on the other hand, the other lab that tested that same sample is coming back reporting that sample to be toxic, that there is actually a problem that needs to be addressed at the treatment facility. And so we can conclude with information like this, that there are test-related factors that cause labs to disagree on whether discharge samples are toxic. Please advance the slide. And this brings us to our key concern. While we have led a number of toxicity reduction evaluations that have successfully used Cereodaphnia to address and resolve instances of toxicity, it is still well documented that there is a highly variable organism response on non-toxic blank samples, even across good labs in California. And so if these Cereodaphnia test issues are not addressed and they're not accounted for in some manner, then these dischargers are going to be issued violations, even when the discharge is not the cause of the exceedance. And the actions that would come forth from these violations, so that the actions by these agencies will not improve water quality, they're not otherwise going to affect the treatment efficiency of the treatment plant. Please advance the slide. Which brings us to our request. This is our sole and final request with regards to Cereodaphnia. And what we're asking for at this point in time is a change, some clarity in the adoption resolution. We think it's appropriate that the adoption resolution provides some additional clarity that indicates that the study is intended to identify causes of false indications of toxicity on both blank and compliant samples, because there's such a nexus between the two when it comes to dischargers' concerns. And that the study is also intended to provide recommendations, that are proven to minimize test issues from causing violations. And so why is this a concern for dischargers, so late in the hour? Well, dischargers are concerned that their number one issue here, which is test-related factors resulting in violations or exceedances, that it won't be adequately addressed in the study. POTWs make up a small minority of those that compose the stakeholder advisory group of the Cereodaphnia special study. And certainly a number of those outside of this community think that the dischargers' concerns with regards to Cereodaphnia, that they're inflated. And so when the discharger community is being asked to contribute $1 million to fund the special study, and they themselves will have to go back, as you know, to their boards and request these funds, that it's important that we can sell the Cereodaphnia study as actually addressing their primary concern. And what we're not asking for here is a complete interlaboratory calibration study. We're asking for some general guidance, overarching guidance that will clarify that the primary concerns of the discharger community will indeed be addressed with the special study. And I have the proposed language at the end of the slide deck here. It's very minor. We think that will go a long way in helping the discharger community and their ratepayers who are going to fund the studies, the public, and the ratepayers that are also going to have to bear the cost of violations and so forth, can get information out of this study that will address this issue with regards to test-related factors causing false indications of toxicity. And so we can go on to the next item now. Item number 2, so we're going to get back to reasonable potential analysis. So in the table here, under the proposed provisions, POTWs that are authorized to discharge at a rate of 5 MGD or greater are required under the federal regulations to have a pretreatment program will automatically be issued effluent limits for chronic toxicity. So there's no reasonable potential analysis provided to that category of dischargers, while those outside of this category are going to undergo the reasonable potential analysis. Now, what I want to communicate more clearly than I did in our briefings with you is that this is actually a shift in board policy. Current board policy is that every single discharger is provided an equal opportunity to conduct reasonable potential analysis for toxic chemical constituents, every permitting cycle using their own data. And under the toxicity provisions, the equal opportunity to conduct reasonable potential analysis for chronic toxicity is not going to be provided to all dischargers, which is setting a new precedent in terms of state policy. Moreover, additional precedent is set with this decision. If the toxicity provisions are adopted as is, it will legitimize the use of these categories, the 5 MGD threshold, the pretreatment program categories, to identify those POTWs that exhibit the greatest risk to water quality. And these thresholds can be used in perpetuity in a manner that will potentially disadvantage this entire category of treatment plants in terms of future policy development, such that the policy writers could justify greater or more stringent requirements simply because dischargers are in this category. And go ahead and advance the slide, please. We've provided in our comment letters and both in our briefing notes to you a lot of technical data that justifies that these categories are not good proxies for water quality risk. In contrast, the staff report does not provide a technical analysis to support the use of these categories. Here, I'll just summarize some of our reasoning. There are actually very few instances of toxicity that have been identified as caused by industrial discharges into a treatment plant. So industrial facilities discharging into the sewer, that making it into the treatment plant. There are actually very few documented cases when the data has been compiled that industry is the cause of toxicity. Moreover, these pre-treatment programs, as Karen pointed out, Ms. Mogus, my apologies, is that these programs require actual pollutant limits on the discharges from industry into the treatment plant. So these expensive programs that the municipalities need to implement, they actually control pollutants and provide protection rather than being indicators of risk. And then moreover, some of those treatment plants that are in this category of 5 MGD and having a pre-treatment program, they may just have very negligible industrial flows into the treatment plant, as I've summarized in tables in our comment letters. I also want to point out that in our final briefing, which we had with Chair Esquivel yesterday, which we appreciate your time, Patrick Palupa, the executive officer of the Central Valley Water Board, joined us for that meeting. And he indicated, and I have permission to cite him here, is that when in evaluating reasonable potential for toxicity, it is an important part of the Central Valley Water Board's permitting process. At least for permittees in the Central Valley, the board's technical staff has not found that either a 5 MGD threshold nor the existence of the pretreatment program are accurate proxies for water quality risk in all circumstances. So that takes me to our next slide, please, and to our request. So our request stands, we've put this forward before, that we are requesting that the reasonable potential analysis that's already written into the provisions be applied to all dischargers, and the effluent limits only be issued to those POTWs that are demonstrated with their own data to have reasonable potential. And the purpose or the reasoning behind this request is that it continues to keep in existence the current board policy of providing an equal opportunity to all dischargers to use their own data to conduct reasonable potential analysis. And it's also equitable. It's going to prevent against disadvantaging this entire class, potentially disadvantaging this entire class of POTWs when it comes to future water quality policies. And then we also feel like it's protective because, as was pointed out earlier, the reasonable potential analysis is conservative. So it will bring in dischargers to having effluent limits in a manner that is conservative, such that it protects water quality. And moreover, even if a discharger does not exhibit reasonable potential for toxicity, so they're not issued the effluent limit in their permit, then in their permit, they will receive these toxicity targets. They will conduct routine monitoring. And if they exceed the targets, then they'll be required to conduct the toxicity reduction evaluation to identify and rectify the cause of their toxicity. And then in the next permitting cycle, they're very likely to get an effluent limit because they exhibit reasonable potential. And then just lastly, well, let's go ahead and go on to the next slide. I just want to thank all of you for your time, and especially staff that have spent so much time engaging us on our numerous questions and comments. And they've done a prolific amount of work to get the provisions to where they are today. Our proposed changes to address these two remaining comments are actually very minor and straightforward, as we will show on the next slide. So if you have any questions, I'm certainly happy to address those now. Thank you.
Thank you, Mr. Bador. I don't think I have any questions, just to flag, since this is, we're talking about statistical methods and significance of statistical numbers, that the studies that you flag there as sort of evidence for really great concern with variability are relatively small samples. And I think that we saw out of the studies that you quoted there, the one with the most number of samples, 27 at the EPA data, actually saw a huge drop in what can be some of that variability. We've committed to doing the study just because of this question, and to your point, hope that folks, dischargers, really do have confidence in the structuring of that analysis, so that we just have a better understanding of that variability and improve, and if need be, again, improve when it comes to the methods within the lab to reduce it if there are particular things that seem to be causing that variability. So that being said, I do appreciate, though, the recommendations and comments here. We'll take them into consideration. Sure. Any questions from fellow board members?
I just would love to hear from staff more on the proposed language on this study, just how that is different in meaning from what the intent is for our study, or if it isn't different.
You mean how it's different from what's being proposed by Mr. Bador?
Yes.
Okay. Just making clear what your question is. So our study is not intended to be a blank study, although I will say there will be blank samples sent to laboratories, blind blank samples sent to laboratories to determine if we're getting, results of toxicity on a blank sample in certain labs. That will then be used not necessarily to make all of the labs consistent, but to identify where a certain lab may have method issues that we need to look more closely into. So it's not intended to be a blank study or an intercalibration study among labs. It's intended to look at ways that we can lift up all of the lab performance so that we have complete confidence in all of the results that are coming out of the labs that are accredited in California. Did that help?
Yeah, it helped me. And I'm just wondering, Mr. Bador, if that is different than what you're asking for.
No, I actually think what Karen communicated was a really good, accurate summary of what we're asking for. And I think that's captured in the language that we've provided. And that I can take what Karen said and the additional language, which I think is what we're asking for. We're not asking for more than that to direct a big blank study. That's not what we're looking for. I'm looking for language that we can go back to POTWs in the Central Valley and say, your issues are going to be addressed. And I think the language we propose, being straightforward and simple, is something that meets that goal.
Can I make a suggestion, which is all along we have intended that the objectives of the study be developed in conjunction with the stakeholder advisory group who's meeting next week, as well as the expert panel. And that to point to the notes from those meetings for your clients would be, in my opinion, preferable than for us to presume at this point, a week ahead of the meeting, what all of the objectives will be for the study. And so rather than be exhaustive in objectives in the resolution, that we wait for the stakeholders to convene and the expert panel to convene to really flesh out the specifics of the study.
Yeah, and I will say that I think the direction as it's written provides that basis. I think it's pretty clear what we're looking to do. The inter-lab variability, we referenced there. So I think, I don't know, Board Member McGuire, I think maybe you're going to chime in as well. But I'd just say, I have confidence in the language as written a bit.
Yeah, I'll just chime in and say it sounds like Mr. Bador actually was encouraged by the description that Ms. Mogus provided about the blank samples that will be provided to the labs. And so, for one, if the intent is to look at this as a component of the scope, I don't know if it needs to be this exact language, but I don't have a problem acknowledging that that is a component of the study in the resolution language, if that would help. So I just want to say that I would support some massaging of this piece a little bit, just to indicate that that will be an aspect that we'll look at.
Well, I'd open it back up then to other stakeholders then that are on the call with us to think through what they might also want as part of it. But I think we find, again, ourselves where we're trying to decide here from the dais, something that is going to be further discussed at the stakeholder group. And anyway, open to thoughts.
I appreciate what Board Member McGuire said, but I would tend to agree that if we try to finesse everything, it we could be here a while, more than 17 years. But it's really, if we are going to form a expert panel, if we're going to have an engaged process moving forward on this, I'd rather not try to tie their hands by trying to finesse certain things and putting in the resolution right now. I think I would agree to keep the resolution language as broad and flexible as possible, rather than trying to anticipate various factors to include.
So I've been involved in many of these studies and expert panels and scoping, and the reality is, the more you add, the more expensive it is, and the stakeholders need to really do a trade-off on cost versus how exacting they want the study. And you can't really do that in the abstract. You need to do that as you look at what the pieces of it are, and if you want to add something to add more specificity to it, it's going to increase the cost, and the stakeholders need to know what that is before it's decided. And that's why we do it, an expert panel to give what are the pieces of it, and then the stakeholder group to decide, what level of effort makes sense for those pieces. So my suggestion is we clear that we want to look at improving lab performance associated with Daphne and what those rules are, but the exact pieces of that should be first from the expert panel, and then worked with the stakeholder group to determine what would be done. And I would suggest, though I can't guarantee it, would be that if the stakeholder group as a group doesn't want to do a piece that a group of dischargers want to do, they're likely to be able to do that if they're willing to pay for it.
I think that's helpful. And I do think this discussion here today will help signal that desire. And if Mr. Bedore, if the dischargers really do want to support this, I've heard from you, I've heard from many stakeholders and dischargers that the false positive issue has been an ongoing and very prevalent and pressing concern. And so, I just wouldn't want to go through the next 2 years as we're driving towards numeric effluent limits here, only to end up with a study that doesn't really answer all of the fundamental questions that were the original concerns that dischargers brought to the table. So it sounds like it's going to be incorporated, and I agree with you. I think through the scoping process, this can be addressed and clarified. If it costs more money, that's a question that needs to be answered and addressed. And again, I think I could live perhaps with not amending the resolution language today, just acknowledging that it's an issue that I would like some follow-up on as we go forward here with the development of the study.
Thank you, board member. And thank you, Mr. Bedore. Vice Chair.
I really appreciate
Yeah, I'll just chime in here. It seems that we'll be sticking with the language that we have, and I'm just going to jump in here because I think, Mr. Bedore, you may want to go back and look at the tape, and so I'll just jump in here as well. I think that between Appendix J and the work that our staff has done in this area, that there's some confidence anyway that this issue is going to be put to rest. But I agree with Board Member McGuire. It's best to just construct these questions through the stakeholder process in such a way that we can tease out any remaining issues. And so for me, it's not just improvement of lab practices, but the cost, not just of the study, but the cost of what it's going to take to get you the information that you need about, not you personally, but all of the POTWs and the information that they need in order to have that confidence going forward, that with improved lab practices that we can, finally put this matter to rest within the range of acceptability of false positives. So I'll just chime in here to encourage you to continue those discussions, and my support that the study be constructed in such a way that these issues can be further clarified. Again, not suggesting that we're moving in the wrong direction, wanting to reference back the appendix and the work that our staff has completed in the staff report. So I think if we move forward today, we're expressing as a board, confidence in the toxicity provisions, but at the same time, the need to address lab practices so that we can put this issue to rest.
Thank you, Vice Chair. I think that's a good summary. And I'll even go maybe a somewhat step further and just suggest perhaps we have an informational item once the study is developed, so folks can come back and tell us if we're going in the right direction with it. Thank you, Mr. Bishop.
Yeah, we're happy to do that. We'll also let you, as the board members, know when the stakeholder meetings are, if you're interested in, joining in on those and help shape the study requirements.
Thank you for that. And again, hopefully that does give confidence, Mr. Bador, to your clients that we do take this question seriously. And so, and just appreciate the continued engagement on that and look forward to more. So thank you. I think with that, if there's no other comment or question, again, appreciate it. And we can move on to our next speaker. Quick time check. I think we're still good. I'd like to call up Ellen Blake with the US EPA. Good morning, Ms. Blake.
Good morning. So my name, again for the record, is Ellen Blake, and I am Assistant Director at US EPA.
I'm sorry, one more, Ms. Blake. I don't believe we can hear you very well. The room, I believe, is unmuted. We're getting some background noise. The coastal hearing room, that is. Okay, Ms. Blake.
So I am representing US EPA Region 9 Water Division. So the opportunity to testify regarding the revised toxicity. So let me start by reiterating, as we've heard today, that EPA supports California's efforts to develop a unified approach to protecting non-ocean waters from toxicity. These toxicity controls complement California's chemical-specific objectives and are key to protecting surface water quality from otherwise unmonitored contaminants. We commend California's progress and note that the provisions are based on robust science, encompass more than 10 years of stakeholder outreach, and build on a long history of quality.
I apologize, Ms. Blake. You are cutting in and out a little bit. Perhaps if you just move the mic a bit closer or speak a bit louder may help. Sorry.
Yep. Is this better? So the proposed provisions provide a consistent statewide framework for development of clear toxicity effluent limits. The NPDES permitting regulations require permits to include toxicity effluent limits expressed as daily and monthly limits if there is reasonable potential to cause an excursion of an applicable water quality standard. California's provisions accomplish this. In addition, to decrease the potential for permit violations based on a single toxicity test, the provisions use a high magnitude daily limit held in check by a median monthly limit rooted in the statistical approach of the objective. These limits further reduce the rate of false results when toxicity levels are acceptably low. California has also chosen a statistical approach that provides a transparent incentive for California labs to produce quality data. We recognize, as we just heard, that the state board is proceeding with a time-limited study to build confidence by examining how labs can improve performance. We continue to have confidence in the chronic C. dubia reproduction test and in the ability of California labs to run high-quality tests using C. dubia. And as such, we believe that effluent limits are appropriate for C. dubia. To further the goal of improved laboratory performance, we recommend that California ask laboratories to supply performance data to assist in evaluation of their long-run control coefficient of variation as a measure of their ongoing laboratory performance. We do agree that an independent science panel of national experts will provide insights as to how laboratories can achieve an acceptable level of performance, and we support focusing the study in this area. We'll continue to work with the state board staff and stakeholders on the study. We also recommend that the state board provide further guidance and training for permit writers to ensure implementation of these provisions complies with the Clean Water Act, including applicable NPDES permitting regulations governing the inclusion of water quality-based toxicity effluent limits and requirements around anti-backsliding and anti-degradation. We're available to assist in the development of training and guidance materials. And then EPA will also, as per our 1989 MOU with California, continue to review NPDES permits in our oversight capacity. We understand that California has submitted an application for the review of an alternative test procedure, or ATP, to reduce the number of effluent concentrations from 5 concentrations to 1 effluent and a control. I want to note that EPA's review of an ATP application is conducted by our Quality Assurance Office and will proceed on a separate path. I also want to reiterate that an ATP approval is not required for use of the test of significant toxicity, or TST. That's the statistical approach to analyze the toxicity data that California has chosen. The TST, which only analyzes data from a single effluent concentration and a control, can be used consistently with EPA promulgated toxicity test methods found at 40 CFR Part 136, which require 5 effluent concentrations be tested. Laboratories can still run tests with 5 effluent concentrations and conduct the statistical analysis with the TST. As EPA has said many times, the TST is not a toxicity test method. Sorry, loud truck going by. The TST is not a toxicity test method, but rather a statistical approach that can be used to assess toxicity test data, the actual biological response, generated at the completion of a test. ATP approval is needed only to reduce the required number of effluent concentrations to be tested when using the promulgated toxicity test methods. So in closing, we appreciate California's progress towards a consistent and clear approach to address aquatic toxicity, and again, commend the tremendous work that California and the staff have done to further the robust science around controlling toxicity. I will definitely stick around to answer questions if you have any.
Thank you so much, Ms. Blake, for your comments and the note of the importance of this nationally as well. You know, I think ultimately when it comes to the guidance documents, even the study and the confidence that hopefully that brings to it, it has hopefully benefit to the greater regulatory community nationally around, you know, how best we do continue to improve toxicity testing is, you know, really the last line of defense we know it is against pollutants we don't know or can characterize yet, but you know, ever vigilant of emerging contaminants of concern, certainly. So just thank you for your comments and leadership there as well. I don't think I have any direct question right now, but Ms. Stoda, I think perhaps you do.
I might add also my note of thanks to EPA Region 9 for your longstanding partnership and collaboration with the board and board staff on this issue. As we stated, you know, going back 17 years. I remember, I believe you even loaned Dr. Deborah Denton to us at one point to work entirely on this issue. So this, this day is also, I think, a day of, should the board act to adopt this, also a day of celebration of the longstanding partnership between our agencies and the EPA Region 9's commitment to this effort and your support to us in this effort. So thank you very much. And to your former Water Division Director, now member of the San Francisco Bay Regional Water Board, if Alexis is watching, many thanks goes to her as well for her leadership while she was at EPA Region 9 in helping to support this effort.
Hear, hear. Thank you so much, Board Member Dodak. Any other comments or thoughts from folks? Great. Hearing none. Thank you so much, Ms. Blake. Really appreciate your comments. Next, we have up Jared Voskel from the California Association of Sanitation Agencies.
Hi, good morning, Chair and board members. Good to see you all. Jared Vosco on behalf of CASA. CASA represents over 125 public agencies in cities throughout the state that provide wastewater collection, treatment, and recycling services. At the end of a long year here, featuring numerous policy milestones for the State Water Board, it seems fitting that it concludes now in December with the toxicity provisions, which have been 15 years in the making. We want to first begin by thanking the State Water Board for your accessibility and availability since the release of the final draft materials to discuss the remaining issues for our sector pertaining to these regulations. Also, we want to recognize the State Water Board staff and council for listening and working with us and finding balances and providing accommodations to our needs for a more practicable set of regulations. Over this past fall, I've attended your meetings each month, and on complex items appearing before you, you've heard impassioned testimony, received detailed presentations, and held in-depth discussions from the once-through cooling policy to the water quality fees for next year, to lowering the DLR for perchlorate into 2 phases, and approving the 303D listing for multiple regions. Listening to and watching all of those board discussions unfold, I've been so impressed with the level of discourse and engagement with various stakeholders' needs. And so today we're going to ask you to do it one more time this year on these remaining issues, to listen to the stakeholders in the regulated community and on the final changes that are being sought. And on this part, it kind of feels like tightening a screw. I've heard the difference between a good set of regulations and a great set of regulations is that final twist. And it's the hardest part and it takes the most effort, but it really does make a difference for us. And so broadly, we're aligned and agree with the concerns which were identified by Paul, and our sector is open to contributing to see that blank study that was discussed. And we're supportive of a check-in informational item in the new year with the stakeholder process. Likewise, we support the remarks you'll hear from Civiqua and BACWA and SCAP. And as to those issues, several of the ones we previously expressed have been addressed in the change sheets released over the last week. And we really want to acknowledge and thank you for that. I know a lot of time and work over the holiday break was poured into these proceedings by all of us. And here I'd also like to respectfully request your admission into the record, the written comments that were submitted in the last week on the adoption resolution that the board's considering today. We still have our overarching concerns with the imposition of numeric objectives and associated numeric limits for chronic toxicity. Likewise, we think there are issues with mandating the use of the unpromulgated test of significant toxicity in the provisions, particularly when applied to the Cereodaphna reproduction endpoint. And that's principally due to the studies showing an acceptably high rate of false positives. Board staff have expressed to us that the test is reliable and there's no issue with the test and that it's fine. And we hear and understand it is on paper. But I think from the discharger perspective, what we're seeing is that toxicity is found in blank samples. And we think that could be attributable to the endpoint, which is particularly troublesome because the results derive from counting how many offspring of the water flea are produced. In the absence of any contributing factors, that figure can range between 15 and 45 offspring in a valid non-toxic control, resulting in a range whose upper bound is 300% higher than its lower bound. And with such high inherent variability, it's exceptionally difficult to reliably identify a true 25% effect in the reproduction endpoint, which is the regulatory management decision that is automatically set to go into effect on January 1st under the provisions as written. To this point, we are appreciative to the board for pursuing the Stereo study, and we are hopeful that it will produce guidance for labs that reduce the performance-based causes of false indications of toxicity, such that the test can be executed with the precision needed to meet the target false positivity probability of 5%. Further on the study, we appreciated that Resolution 9 and Change Sheet 1 moved back the board's check-in date from September to July, but we do think it could and should be earlier in 2023, perhaps in February or March, which would be 60 days or 1 quarter after when the final report is due. This change would provide the state and the regulated community more time before the January 2024 implementation date for any follow-along actions proceeding from recommendations in the final report for them to be initiated and planned. And this would amount to more time for the State Water Board to take action to modify its course based on the findings from the study without jeopardy to POTWs. This is also important in requirements that need to be established. If there's other items like an alternative test procedure, that time would be beneficial. But to that end, we appreciated the other edits on Resolution 9 on the change sheet, acknowledging different outcomes. But perhaps beyond language about the scope of the study in the resolution, we still prefer stronger language about the check-in. So it wouldn't be just a check-in, but more of a decision point that would entail confirmation that the findings or results from the study in fact, do provide to the state the assurance necessary that the regulated community can execute the test with the precision needed to meet the target false positive probability of 5%. We previously provided draft language in our August comment letter that could be adapted here that would effectuate the provisions today, but also create pathways after the study for the state to pursue different outcomes instead of one discrete course that automatically sets into effect the use of this area for MMEL compliance. Beyond this matter and to close, I just again want to commend the board's work here. The final versions of the provisions, the staff report, and the adopting resolution really represent a feat by the State Water Board members, the staff, and the council of just listening to all the parties, balancing numerous interests, securing compromises between stakeholders, clearly articulating the underlying rationales for choices, and being particularly responsive to our sector's needs. So to that, we respectfully request your consideration of these requests and the ones you'll hear from Savikwa Bachman Scout. Thank you.
Thank you so much, Mr. Voskel, for your continued engagement around all this discussion. I appreciate it. Next, I think I'll call up Debbie Webster, Central Valley Clean Water Association. Good morning, Ms. Webster.
Good morning. How are you doing? All right. Well, thank you, Chair Escobar and board members. My name is Debbie Webster, and I'm the Executive Officer of the Central Valley Clean Water Association. I really appreciate the opportunity to speak this morning and to continue our discussion on this policy, and really hope to be able to wrap it up also today. But there are some important areas that we think are needed to be addressed. And so I do want to start by a couple things. So for supporting the comments of CASA, SCAP, BACWA, and then Paul Bedore at RVI. And just to let you know that we will be presenting, I will be presenting something slightly different with regards to use of triggers. But one of the solutions that we feel might help at least get a Central Valley voice is to have a Central Valley representative on the list of stakeholders for this area Daphne study. Not only does the Central Valley have about a third of the POTWs that have NPDES permits in the state, but over half of those are in the state are to fresh water and reside in the Central Valley. So we think that that might be a solution. That just was added this morning. So anyways, first, I also want to say thank you to the staff. We really appreciate both changes that were made to the change sheet. First, with change sheet 1, the language that was removed regarding the IWC that was inconsistent with the SIP. We very much support that. That will remove some confusion and it keep determination of the IWC consistent with the SIP. And then also the change sheet number 2, which provides that additional time and removes some need for overlap for those that have less than monthly testing requirements. So really, I do appreciate that. But I do want to continue to comment on 2 areas this morning. One is on monitoring and basically some of the timing of the MMEL compliance testing, and the second one being the use of targets for POTWs when there's no reasonable potential. So can you advance to the next slide, please? This slide you have seen, I know we spoke with many of you about, board members about this, and it was in 2 of our comment letters, but it really depicts some of the issues that we have with 3 requiring not only the first test, but the 2 compliance tests if needed in a single month, and some of the problems with that. Now, again, I really do want to recognize and appreciate that some of the overlapping issues are resolved for some of those smaller agencies, but the difficulty in doing 3 tests in 30 days is it is a big lift. And you heard last year from a number of POTWs, lab representatives at POTWs of varying sizes throughout the state on just how difficult this is. And this requirement is still in there for even the smallest of our agencies. So I kind of want to walk you through is to say, you know, what is required to actually do these tests. First of all, in the average life of a POTW, they have to clean up the sampler, get it all ready, and put it out on their first sampling day in the morning. They go back and they pick it up the next day. They put in another sampler the second day. This is for, by the way, this is for Stereodaphnia and fathead minnow. Selenastrum does not require this. They go out. We've picked it up the second day. They put it out, or we picked it up the second day. We put it out again on the third day to collect another 24-hour composite sample. Pick that up on the fourth day. Put a new sampler out on the fifth day and pick that up on the sixth day. And so it's really, it really is, even though it says day 1 to 5, it is a 6-day process for a POTW in the amount of work that they have to do. And in that, there is cleaning that sample, getting the tubing, getting everything ready to take a good clean sample. And then there is the collecting the sample, and whether it's getting it over to the lab because the lab is close to you and you can actually, pack it up in its ice and drive it over there, or you have to mail it overnight. That's the logistics of what we take. So it's always going to be anywhere from 2 hours to up to a half a day just doing that normally. And for our smallest agencies who maybe don't have their operator or somebody else doing it, it's actually drive time to go out there and come back. And so this is a pretty hefty list. Now, for some of our agencies that have that have BOD monitoring, they're setting out a composite sample anyways. But if they're not setting it, if they don't have something that requires 3 times a week, i.e. they're doing something less, it then is they're going out extra times and having these extra parts. When it comes to the lab, depending upon the temperature, if it came that day, they might have to cool it, or if it was overnight received, they have to start the test 36 hours within the time that it's finished. And so even though it says that the testing may begin on lab 2, you actually, day 2, you might actually be on day 3 because you started on 1, got it on 2, sent it overnight on 3, and that's when they started the test. And these tests are 6 to 8 day tests. Yes, if something goes horribly wrong, you can find out very quickly that there's a problem. Sometimes it's in the QA/QC that takes a while. So it really does push you out. And so that's just a normal test. And the difference that we see is between this and I want to say between other states, we did look at what other states do. We looked at Arizona, we looked at Hawaii. They have a different testing regime, but typically what happens there and what has happened in other permits is you get that result and then they give you 2 weeks to start a series of 2 or 3 tests that are 2 weeks separated. So that extra time to prepare for 3 weeks, 3 different tests that are 2 weeks apart, you can prepare for that. In this case, we're scrambling if there is a fail of any sort to do our second test. Finally, so you're going through the same thing with the second test and you're waiting for, you may or may not get your results back, and all these time frames you see on this timeline are from Appendix K. These are not things that we've made up, but there are things that aren't included in here. So this is actually a pretty good, optimistic case. There's things where you might have to wait because there's not any test species. There's things that are test species are not available. There's things that are considered outside the control of the POTW, and we really appreciate that there's provisions that address that. But there are some things, especially with these, whether it's smaller labs or others, that really make it difficult. It may be that, you don't have someone, it's a holiday weekend. We have issues with COVID. You have other emergencies that come up, and especially if you're a small staffed agency, that make it difficult to do the 3 and 30 days. And that is why you have heard so many times from us and from our members who continue to say this is a huge issue of why we're looking for additional flexibility to, if you have to do that third test, especially with these long tests, to be able to have some flexibility. Also, with the change sheet, if you look at that third one in that first month and that first one in the second month, with the change sheet, you've given flexibility for those less than monthly monitoring regimes to now be able to wait till they get the results of the third sample back before they start a first sample to see whether it's needed. But we do look at this and say, even for the monthly samples, there's going to be a lot of overlap in that sample. And you're basically either going to be doing a lot of split sampling or you're going to be doing overlap. And really, why are we doing that in a case of especially, as we talked earlier today, the COVID and the financial areas and really the impact that this makes. Our agencies are already paying for additional monitoring. Let's try to find ways that we can still protect the environment but save costs. And so if you go to the next slide, we have a recommendation, and that would be, and I want to let you know, is we've tried to work different types of recommendations out with staff on this, but this is a recommendation that we're asking, is to let our regional boards have some discretion to allow that compliance test, that third test and the first test of the next month or that following test to be used as a single test, not duplicating, not doing split sampling. Allow those tests to be the same, and so you would be able to comply without that overlap. We also think that similar edits are appropriate for replacement tests, and replacement tests. Lorian from BACWA will be getting into this a little bit more, but those replacement tests is when something happens, at the lab or outside of the control, where you've now, let's say that in your controls you had too many, on stereo you had too many females die, and so, or they didn't produce as much as they were supposed to, and so it's outside of the control issues, and now you're having to go out, resample, take a new test, pay for that new test and all the costs that are associated with it. So really, this doesn't say, hey, it's an automatic, but it does give your regional board, this one would give the regional board discretion. Okay, can we go on to the next?
Ms. Webster, I'll flag, I think you've run through your time at this point, so if you are able to kind of wrap up soon, it'd be appreciated.
Did I ask for 8 minutes? Did I go over that?
You've gone over 11 minutes at this point, Ms. Webster.
Oh my goodness, I'm so sorry. I will really wrap up quickly then. Thank you, I'm so sorry. But if I can go to the next slide, please, and I'll do this very quickly. The last issue that we had was that for POTWs that do not have reasonable potential, unlike what was said by Karen earlier, we're not asking that they do not have routine monitoring, but that they have routine monitoring, but not have targets, which are very similar to limitations. It would allow the regional boards to give them receiving monitoring limitations and take appropriate actions from there. And again, I apologize for going over, but I'm very happy to answer any questions. Thank you.
No, it's more than okay. Thank you for your comments. Much appreciated. I don't have any question at this point. I'll continue to, I appreciate, I know that you continue to flag that you feel the hitting 3 tests in a single month is going to be very problematic. I appreciate the continued thought on how to best maybe massage that. I'll continue to take into consideration. I know there is still some back and forth around that, but I appreciate it. Any other board members though like to ask questions?
Not really a question, but I guess I would like to hear from staff. It doesn't have to be right now, but at some point here before we get too far along, I would like to hear staff's thoughts on CEBICWA's request with regard to the flexibility and the compliance sampling. So if we could hear from them at some point, I appreciate it. Thanks.
I think
Want to hear from me now?
Yeah.
That would be fantastic.
Well, I'll just say that we don't agree on the timeline, that the amount of time in the lab that is estimated by Ms. Webster is not a best case scenario. I think labs can get information to their dischargers very quickly if they suspect that a test is going to result in a fail of a TST. And that's just going to require a good communication between the discharger and their lab, whether that be within their facility or their commercial laboratory. And I think our Appendix K demonstrates that the labs that do have good communication with their dischargers work very well and accommodate the needs as necessary. If you look at the Appendix K calendar month timeline, we estimate that the second MMEL compliance test could easily be initiated anywhere between day 16, so middle of the calendar month, to day 28 for that very short February month. So we don't agree with the timeline that Debbie presented. I won't go into any more detail than that, but we certainly agree that it takes good communication and coordination between dischargers and labs to achieve a third sample and a test initiation in a calendar month, but it is not by any means impossible or infeasible. And in fact, there are dischargers in the state who have to complete their third test within a calendar month, according to their permit requirements. So the other issue with the request to use the routine monitoring test in the next calendar month as the second compliance test for the previous calendar month is that if you think about where does that data then go, it will need to be a data point for calendar month number 1 to basically break the tie for what would have been a pass and a fail of the first 2 tests conducted in that month, but then also be a data point for the following calendar month to assess compliance with the next month's MMEL. Technically, I think that's problematic. I think it's also problematic for our permit writers for assessing violations. I think it's a data system problem that makes reporting more complicated. It's certainly doable and certainly a policy call that the board could make. I just wanted to point out some of the limitations and complications that may cause. And I'm probably not thinking of all of them actually either.
So I would like to bring to the board's attention that if you're doing that third sample and it fails, so your first month is now out of compliance, you are also then said your first sample for the next month is also in violation. So you're potentially getting 2 months of violation based on 1 sample, which I think you will hear if that happens, that will be problematic.
Okay, that's helpful. And, Ms. Webster, as I'm thinking through these issues still, and I need a little time still to mull this over today, but any thoughts to that? Because that was an issue that had been raised, and I just curious as to whether you think that's a worthwhile risk to afford a little bit more time. Having that that first sample the second month possibly being a compliance issue.
And that part of the reason why we put that language, we actually thought about it, and really it is the way that we have a recommended language, or the recommended language leaves that up both to the conversation between the board staff and the POTW, because it doesn't say they have to use it. It does, they say may use it, the language that we have, and I pull it up on my computer just so I can look at it. So really there is some discretion there in from both sides. We're not forcing the issue one way or the other. I think the benefit that we're seeing is if you're testing the same water you're having two samples that are testing the same water. What happened, or pretty close to the same water? I mean, what happens when you get different results? That's, you know, then, and this is part of the issue that we have with that. Or are we going to pay, you know, on the flip side, are we going to pay twice for testing pretty close to the same water? And so, again, you know, you know, as we look at, I understand that in Region 4, they do 3 tests a month. We've talked with them. It's difficult. It's a lot of them, they're, you know, they're not remote. Their labs down the street. And I will agree with Karen, is if your sample, your species dies the first day or something really bad happens really early, you can hear back early. But if you're on that borderline, it is not a hear back early and really looking at Appendix K. This is the time frames that they heard back from the lab. And they said, yeah, for early response, we can get back to you 1 or 2 days. Some of the labs, and we have some in the Central Valley, that get charged additional money to get the results back early. So it's not, there is a good communication, but it does cost, and some of them. So going to this third test, if you're going to be out there and you're trying to wait till you hear back on that second test, whether or not you're going to need to put, you need to put your monthly out, you may make that decision, talk with your board saying, hey, this is the same thing, can I use both of these results? And that's what we're envisioning here, is being able to have that choice and being able to listen, to have those results in order to turn around and say, yes, you know, I need this third compliance test or I don't need it.
So can I ask you, Debbie, a question, Chair Escobar?
Mm-hmm.
So what I understand what you're suggesting is that that there would be a flexibility for the POTW to decide if they were going to use the sample from the next month as both for 2 months or not. Is you're envisioning that if it's violated, you wouldn't use it and you take another sample to try and determine, and if it's clean, you would say, well, that's clean for both months.
No, it wasn't envisioning trying to kind of game the system. That's not what the envisioning was. The envisioning is more of a, you're making that decision as you're taking the sample before you know the result.
Well, you wouldn't take the sample if you didn't know the results. You would just be taking your monthly sample.
Well, here's where, again, the timeline comes back into play, is if you have those results. Okay, so under normal circumstances that we're operating right now, is normally most labs, you get the results 2 weeks after they complete. You get the report, they've gone through all the QA, QC 2 weeks after they end the results. So you're finding that out later. We're already talking about being in that time frame in order to be able to set up. We're talking about being in that time frame where there is something that happens, you're getting early results, everything's having to be perfect. We're also talking about a time frame where we don't care about weekends, holidays, staff, whatever, because you're going to have to get yourself in order to take the second test. And, you know, let's say that the first test was a monthly median. So you don't have a violation yet. The second test is clean. The third test, you're not going to know whether or not there's a problem or not, but you're going to have to take that third test and your first of the month, because if it comes back negative, you need to now, if it comes back negative, okay, you're back on your monthly monitoring, so that's your first, so you still have this overlap. If it comes back positive, you're now, this first one, you can't wait for it because you've got to fit 3 more in the next month. And that's why we're talking about you having the POTW have the ability to work with the regional board to determine if they can not have that overlap and be able to use that sample. And we're not talking about gaming that.
If I may jump in here. You know, when it comes to setting statewide policies such as this, complicated statewide policies such as this, we walk a very fine line between trying to ensure statewide consistency, which is the purpose of doing a statewide policy, and yet provide the regional board with some flexibility to adapt for local needs and conditions. And, you know, I think what the staff has done with this set of proposal is try to balance that. And my concern with where this discussion is going is, for me, that tips the balance a lot, because we're talking about opening a huge variable with respect to testing and what is, you know, accepted as a result based on hypothetical scenarios at this point, where there is a disagreement between staff and Ms. Webster's and others with respect to this timing. And so rather, my preference for now is, rather than trying to create more uncertainty with respect to, you know, this methodology and how it might be implemented, that we maintain this delicate balance right now between consistency and flexibility. And we're already talking about having the staff report back on implementation. And so this is another area where we can flag for them to monitor and report back, rather than, you know, trying right now to make changes on the fly based on hypotheticals and disagreements between various opinions on what is what. I'm uncomfortable right now with, again, tipping that balance between statewide consistency and regional flexibility on such a hypothetical discussion.
Thank you, board member. I agree with you that I think at this point, the best course, and I appreciate Ms. Webster's concerns and you know, the discussion here, but let's monitor and let's understand and see to what extent we're finding that it's simply not attainable or too costly to attain the 3 tests and within the month timeframe. And again, that is, you know, if that third test again is anyway, we'll see how many times I think this does come up, but we want to be sensitive. But it is difficult at this point and based off of a lot of hypothetical sort of situation. Mr. Bishop.
I was just going to suggest that we would include that in looking at success and failure and reasons for missing the month as part of our reporting. It will be, in most instances, I believe, a target in these first few years, not an effluent limit, and we'd be able to follow that. I know that Ms. Webster doesn't like the idea of the target, but that's really the way toxicity is right now. If you had a toxicity failure, you start a TIE, TRE. So we could commit to documenting and when there's a problem with the timing, what the additional cost associated with that is, and why there was a problem with the timing.
If I might make a request, since Mr. Bishop is here, that staff start drafting some language for a new resolve, directing staff to report back to the board, maybe at the same time, you know, July 2023 or something, with respect to implementation of these provisions, tapping some of the things that we have already discussed in terms of metrics, cost, you know, reports back on the storms effort, this issue. So if you can start thinking about some language for a new resolve, and we can discuss that after you know, all the comments are heard, I'd appreciate it.
Mr. Laufer is working on it as we speak.
There we go.
Thank you both. Vice Chair, was there anything
Yeah,
further?
this is a good discussion, and I appreciate Board Member Dodak, your suggestion on incorporation into a resolution on this. And I just wanted to use this as an opportunity to say that this is an area that I have really struggled with. I think that on the natural, I would be inclined to support Ms. Webster's suggestions, but I also recognize that through putting this together, there's been a lot of give and take, and staff has worked with all the stakeholders, and they're really trying to thread this needle on a way to move forward with consistency, but at the same time provide for some level of flexibility. And I just want to note that in this area, there are several areas, and I know Ms. Mogus already discussed this in her presentation earlier today, but there are several areas where some additional flexibility has already been added in. And I know you're already aware of this, Ms. Webster, but just to let folks know my thinking on this, first of all, that third test just be initiated, not completed, and that where there is a situation outside the discharger's control, the regional board does have the discretion to require the test as soon as possible. And then also in the event that, I'm not remembering the third one, I can't really read my notes here, but up to the regional board to determine if the third test can be counted as to the next month's test, that there is some limited situations where that could be provided. And rather than me going over that, Ms. Mogus or Mr. Bishop, you may want to jump in. But these are three areas where some additional flexibility has been provided, but I do have ongoing concerns, so I appreciate Board Member Dodak's suggestion.
I would agree I agree with those comments and the suggestions that are made by Board Member Dodak as well. And I also want to point to resolved number 8, which directs staff to encourage, accommodate, and support coordinated toxicity sampling and shipping efforts in a more timely and cost-effective manner. So I think there is also an opportunity to learn how to work within these new parameters, to find ways to whether it's pooling resources, looking at some more of the rural, geographically disparate POTWs and others in unique situations, to try and find ways to accommodate these issues and try to move those windows closer so there's less uncertainty with getting those 3 samples when those situations arise. So I know it's not a complete answer, but I think, providing support here, looking at implementation to see how it goes here over the next couple of years and getting that report back will be really instrumental in just understanding to the degree to which this is an issue. Thank you.
Thank you, board members. Board Member First.
So just a really small, probably aspect of this issue, I just want to make sure I understand. So if there is a replacement test that's needed because of problems completely out of their control, of the discharger's control, and the timing of that is such that it's basically the exact same sample, the exact same water that you're sampling for the next month. Does the regional board have discretion to be able to allow, one test rather than having to do a split test in that very small, unique circumstance? Or I just want to understand that requirement, current or proposed requirement.
So are you referring to the scenario where there needs to be a replacement test due to something that occurs out of the discharger's control?
Yes.
Yes. So to clarify what Vice Chair Diadamo indicated, you're keying into the exact thing that I wanted to clarify, which is that yes, the replacement test can overlap and be essentially the same samples that are collected for the next month's routine monitoring. But at this point, that test must be a separate test. The sample can be the same sample. We're silent on whether that is a split sample or collected in a different manner, or hours apart, or however that's being done. So the sample can overlap, and we actually know that that will happen occasionally even without the replacement test, as Debbie, Ms. Webster points out, that a test initiated at the very end of the month will have samples that are very close to, if not the same samples as the ones that are used to initiate the routine monitoring of the subsequent month. So we acknowledge that that's going to occur. Again, the question is do we technically believe that it makes more sense for those to be separate tests for assessment with compliance in 1 month versus a second test that would be assessed for compliance in the next month?
Thanks. And just maybe this is back for Ms. Webster, but if we're requiring 2 tests on the same sample, potentially in this, again, very unique circumstance where it's out of the discharger's control. So this is not kind of regularly. What is the cost difference in terms of having to do 2 tests on that same sample for, or, to give me the exact, but just giving me a sense of what kind of cost of compliance impact that may have?
So I'm just going to, off the top of my head, say it's twice as much because you're conducting 2 tests instead of 1.
Mm-hmm.
But again, we anticipate that being very rare. And if that starts to occur frequently, then there's other issues going on that the regional board should be addressing with the discharger, who should be addressing it with their lab.
Right. And actually just thinking this through, if it's not the discharge, if it's out of the discharger's control, I mean, I don't know if that necessarily means it's within the lab's control, but but it seems like that's something that, in terms of addressing costs, and that again would be rare and should be addressed so it wouldn't occur on a regular basis. So it seems like it'd be a very small, a very rare occurrence. But yeah, I don't know, Ms. Webster, if you want to add anything or
I do. Can I add just one thing? There are commercial labs. I don't think this applies to municipal labs because they're paying for their staff regardless of what occurs. But I do know that there are commercial labs, and unfortunately, I don't know who's on. If there's anybody from a commercial lab, please chime in, that don't charge for when they don't meet test acceptability criteria. And in fact, if I were a discharger, I'd put that in the contract, that I'm not paying you for a test that doesn't meet test acceptability criteria.
Yeah. Great, thanks.
Board members, and thank you, Ms. Webster. We'll move on to our next commenter. We have Lorianne Fono from the Bay Area Clean Water Agencies. Good morning. Oh, afternoon.
Oh, that's right. It is the afternoon now. Thanks for putting that up. So actually, good morning, Chair Esquivel, members of the board. The discussion that just occurred between the board members and staff actually took most of the wind out of my sails, since I was going to be talking a little bit more about the replacement test and duplication. So I'm just going to skip to the end here. So just for the sake of entering into the records, the proposed language, so that if we are in the situation that board member Firestone outlined, where you are literally taking the same water to do the same test, they can count as they can count as the same test. But since I have a couple of minutes, I did want to thank staff for working with us over many, many years on this and really listening to us. And we do understand the challenges associated with making a statewide policy relevant for all these different regions. So we very much appreciate the effort. Probably no questions from the board members, but if you wanted to ask any more about different regions' perspective on the test duplication the overlap times or the challenges in setting up 3 tests in a calendar month, I'm happy to answer.
Thank you so much, Ms. Fano, for your comments and for just acknowledging, we were talking quite a bit on your item, but still, no, I appreciate your suggestion and comment here. Mr. Bishop, do you have something you wanted to add?
I don't want to sound argumentative, but the reason that we're doing 3 tests is so that the discharger has an opportunity to confirm there's toxicity for a monthly medium. We could change that and say there's 1 test a month, and it counts as both your daily sample and your monthly medium. We do that for other constituents and other permits. That eliminates all those problems, but it does cause another problem, which is you get 1 test, and that counts for 2, could potentially count for 2 violations in the of effluent limits.
That's fair, Mr. Bishop. I think there is the point that in the balancing here, we are trying to actually accommodate for concerns and a desire to not just have a 1 pass or fail test here with the TST, but again have this process to kind of weed out any noise in the data. But I think certainly what it bumps up against now, it's sounding like are the logistical challenges of completing that. I think. As we kind of discussed on the last commenter, Ms. Webster, at this point we acknowledge that there may be some challenge there, and then ultimately wanting to monitor things. But your more sort of surgical suggestion for language is something that I'll be mulling those still yet, and I appreciate that recommendation, Ms. Fono, and for the succinctness, obviously, of your comments here. But any other board members with questions or further thought here? Okay, hearing none. Thank you, Ms. Fono. Really do appreciate your good contribution and comment today. Next, we have Steve Jepson with the Treatment Works. Or Southern California Alliance for Publicly Owned.
I know it's a mouthful. Thank you for working with that name.
Of course, early here as Treatment Works on my list. So anyway, good to see you, Mr. Jepson.
Hello, Chair Esquivel, State Water Board members and staff. Thank you for the opportunity to provide comments today on the toxicity provisions. And congratulations to Karen Mogus and Rebecca Fitzgerald and Zane Paulson for all the hard work you've done on this. It really is a huge effort and important for the waters of our state. I'm Steve Jepson, the Executive Director for the Southern California Alliance of Publicly Owned Treatment Works, or SCAP. And we fully support the comments and suggested revisions requested by our Clean Water Summit partners, CASA, BACWA, Civiqua, and also comments you'll hear from Patrick Veazey with Downey Brand, and the comments we heard earlier from Paul Bedore with Robertson Bryan. To avoid redundancy and in the interest of time, we won't repeat those comments and concerns. We appreciate some of the last minute changes, but they don't fully address our primary concerns. There are several paragraphs in the resolution that are not accurate. Paragraph 47 states that the TST has been nationally promulgated. This is not accurate and misleading, and we think it should be deleted. Paragraph 49 states studies have demonstrated a possible false positive rate of 5% for the TST with Pseudodaphne dubia. And we don't have time to get into the details of this study, but it is a bit of a manipulation of central data tendency, mean, median, and some out-of-state data that uses different test acceptability criteria, which skews the data. This paragraph is misleading, and we think it should be clarified or deleted. So to our primary concern, we still have a significant issue with the implementation of the unpromulgated test of significant toxicity statistical guidance using the 2 concentration, 1 concentration plus control method, which eliminates the multi-concentration, 5 concentration plus control safeguard against mistakenly declaring non-toxic water toxic. As Paul Bedore indicated earlier, the TST coupled with Ceredaphnia dubia as a test species is well known for unreliable test results and a high potential for non-toxic water to be declared toxic. This creates an unacceptable risk to POWs of fines from false violations or third-party lawsuits. To be clear, we don't have a problem with Ceredaphnia dubia. We have a problem with Ceredaphnia dubia and the TST and the rate of non-toxic, the false positive rate. The toxicity provision documents themselves even acknowledge this test reliability issue, hence the SWRCB study and delayed implementation of numeric limits. Under federal rules, NPDES permit compliance monitoring must be done according to test procedures and statistical approaches approved under 40 CFR Part 136. The TST statistical method is an unpromulgated guidance document, not proposed or adopted as an amendment to Part 136, even though these rules have been amended 3 times since the 2010 TST guidance was issued. It was great to have some EPA participation earlier this morning and the discussion of the importance of toxicity testing in the state and nationally. And it just raises the question, with the acknowledgement that toxicity testing is so important and in some cases the last line of defense, a test should be promulgated so that the whole nation can use it reliably. So we request that the State Water Board remove the TST element from the toxicity provisions and replace it with the federally promulgated NOEC or EC25, which shares a similar regulatory management decision of 25% effect that's included in the toxicity provisions. After the TST is fully promulgated and reliable, it can be integrated in the toxicity provisions and legally used for compliance purposes. The proposed Ceredaphnia study to be completed by SWRCB, the development of quality assurance recommendations for the Ceredaphnia dubia toxicity test, could be a big step towards TST promulgation. While this may initially sound like a delay, it's not necessarily so. The toxicity provisions already make an allowance for delayed implementation of numeric limits for the Ceredaphnia dubia reproduction test. Using this time to fully promulgate the TST and improve reliability of Ceredaphnia dubia would not necessarily be a delay. And it would avert potential legal challenges to the toxicity provisions. That would certainly be a delay. SCAP is ready to provide a team to assist the State Water Board with technical and legal staff to quickly craft language that would be acceptable to the POTW community while still being protective of water quality. Thanks for the opportunity to comment today. And it has been great to hear the discussion and the back and forth with the stakeholders and the board and the staff. And it's good to see your faces and hear your voices. Thank you.
Thank you, Mr. Jepson. Appreciate your comments. I will ask, and I hope I'm not putting Ms. Blake on the spot, but when it comes to the feeling that our resolution clause, I think specifically the one referencing US EPA's sort of take on this, or maybe Ms. Mogus appropriately. I mean, I'd like to hear if we feel that there's somehow an inaccuracy there in the resolution.
No, resolution number 47 does not indicate the TST is EPA promulgated. What it says is that it's demonstrated the reliability and performance of the Ceredaphnia chronic toxicity test method and has promulgated the method nationally. It's referring to the Ceredaphnia method, not the TST.
That's helpful. Thank you. That's a good clarification. Any questions or thoughts from fellow board members? Okay, thank you, Mr. Jepson, and we can move on to our next speaker. Next, we have Robin Stuber. Good afternoon.
Hi, can you see me and hear me?
Yes, we can.
Great, great. Thank you. Good afternoon, board members. I feel rather cozily fit between SCAP and Downey Brand. Feel a little on the spot here, but my name is Robin Stuber. I'm an unaffiliated member of the public. I'm a retired environmental scientist and an NPDES permit writer, and I've spent more than 27 years setting toxicity QBELs and reviewing California permits. For 5 of these years, I reviewed LA Basin Plan standards, which included the 1994 acute toxicity objective that EPA approved as an applicable water quality standard in 2000. Per federal court order, this objective and its translation methodology for QBELs were approved by EPA in 2002. And if you'll allow me time, I'll return to this topic later in my comments. I have provided a PDF copy of my testimony with references for what I'm saying. As a general rule, I think your toxicity provisions set exemplary public policy for aquatic life protection in California's non-ocean surface waters. On August 23rd, I submitted written comments critical of provisions that improperly delayed implementation of the toxicity objective for sea dubia reproduction. And I won't reiterate those flaws today because I think you've taken a positive step to address those flaws. I support your action as an authorized state to choose statistical toxicity objectives based on sound scientific rationale that protect aquatic life designated uses. These objectives protect against unacceptably high toxicity while considering practical significance for acceptably low toxicity. This choice for safety is reasonable and scientifically defensible because many of California's non-ocean surface waters have reaches that are low flow and dominated by permitted pollutant discharges of wastewater during dry weather, or high flow and dominated by agricultural runoff and permitted pollutant discharges of municipal stormwater during wet weather. It's my opinion that the sustained criticisms of your statistical objectives have been scientifically undisciplined and largely rhetorical. They're often focused on procedural differences between statistical endpoint calculations, even though those differences have no bearing on the variability of what test biological endpoints or the statistical power of the TST approach and the expected statistical error rates experienced in California's toxicity labs under normal operations testing effluents. Your statistical objectives employ a sound scientific approach that has been independently peer-reviewed. This approach is rigorous, clear, and easy to understand and to apply. EPA's wet test biological endpoints, the sample estimates of means and variances, are appropriate for a 2-sample comparison using Welch's t-test. The statistical probabilities of declaring toxicity by Welch's t-test are accurately illustrated by mathematical power curves. Also, peer-reviewed statistical analyses show how 2 inputs directly managed by a toxicity lab, that's long-run control CV and within test replication, play central roles in the estimation and control of a lab's TST error rates for the population of tests it produces. Turning to your October 2020 plan to study Daphnia dubia reproduction, in light of your decision to conduct a study, please note that the conclusions of the SWRCB and CASA reports influencing your decision are flawed in their claims of excessive variation in sea dubia reproduction. Both reports failed to include proper forensic analysis of blank toxicity test results. Forensic analysis of these reports using mathematical statistics conducted by Dr. John Fox show 3 things your study needs to take into account. First of all, within test variability alone does not explain the observed determinations of toxicity by TST. Rather, suppression of sea dubia reproduction by the blank samples played a decisive role. 2, the suppression of sea dubia reproduction of the blanks for these studies indicates that the blanks were not blank. And 3, the high frequency of false positives suggested by these reports is not observed in routine effluent testing by California toxicity labs. Your study of sea dubia reproduction needs to apply current scientific standards for execution and reporting to ensure credibility, validity, and to produce verifiable and reproducible research. A national expert in biostatistics or applied mathematical statistics should be involved in the design of your study to ensure it satisfies these requirements. All raw physical, chemical, and toxicity test data, computer codes, and analyses need to be publicly reported. Once your study is completed, the design, analyses, and interpretation needs to be reviewed by expert statisticians unaffiliated with study participants. Finally, as a matter of public record, some permittee organizations are actively litigating elimination of TST in the NPDES program, including Pseudodaphnia dubia reproduction, or petitioning TST permits. This creates a clear and concerning conflict of interest for any study participant formerly affiliated with these organizations through membership, collaboration on past flawed studies, or current TST litigation and permit petitions. This includes some POT permittee staff and some toxicity labs. For example, Pacific Eco Risk was present at a September 2018 SCAP EPA listening session on a TST litigation case. SWRCB is not immune from this concern either. Left unaddressed and unmonitored by the State Water Board, this conflict of interest is really a gift to the TST litigants and risks tarnishing the reputation of your study and its recommendations before the public. Do I have time to address test endpoint in my testimony? Great. Okay, I have 3 paragraphs here. In 1995, chronic freshwater and acute wet tests at 40 CFR table 40 CFR part 136 table 1A were promulgated for use in California. EPA ratified these tests in 2002. Within the federal regulatory framework for states setting toxicity standards and QBELs, your statewide rulemaking has a parallel. In 1994, the LA Regional Water Board acted similarly. They conducted a region-wide rulemaking to choose the test endpoint percent survival paired with RMDs for survival much higher than 50%. They chose not to use LC50 in EPA's proposed Table 1A because when LC50 QBELs are applied to a zero dilution effluent, for example, to protect the low flow surface water, often with T&E species, they can authorize long runs of unsuitably high mortality right up to 50%. The lower risk percent survival QBELs used by the LA region have appeared in many permits without issue, including the 3 POTW permits connected to the Burbank decision and the 2002 Long Beach and Los Coyotes POTW permits petitioned to you for chronic toxicity. In fact, for 25 years, for specific permitting scenarios, for example, hydrostatic testing in the LA region, these percent survival limits are the only type of toxicity QBELs needed to conform with Clean Water Act requirements. As such, an argument insisting either in part or in whole that only Table 1A endpoints, NOAC, EC25, LC50 must be used to set QBELs, particularly for low and no dilution surface waters, is scientifically not defensible. Neither is it how every state across the country uses wet test endpoints for the many types of permitting scenarios where they set toxicity QBELs. For example, a quick Google search by an experienced permit writer shows that this is not followed by North Carolina, Michigan, Ohio, Arizona, Pennsylvania, Colorado. A lot of states out there doing things differently. Finally, it's useful to understand that applying LC50 and EC25 without confidence intervals in a low flow dilution water or zero dilution effluent increases the risk that harmful effects to aquatic life will be missed, particularly for toxicity lab producing long runs of imprecise tests. The NOAC is not immune from this problem, which is well documented in peer-reviewed journal articles and through LA Regional Board enforcement following toxicity lab auditing. Applying statistical endpoints that can favor such long-run misses of unacceptable toxicity is arguably incompatible with setting toxicity QBELs as stringent as necessary to protect California's non-ocean surface waters, as most are low flow. The Clean Water Act has a general regulatory framework for setting toxicity water quality standards, monthly and daily effluent limits that are QBELs, and associated effluent monitoring requirements for toxicity. States must have the functioning discretion to consider the most scientifically sound offerings of biology, statistics, and mathematics to arrive at a scientifically defensible water quality standard to QBEL setting process using wet test biological endpoints. Your statistical toxicity objectives and translated QBELs explicitly incorporate precautionary safeguards of limiting false positive errors while allowing false negative errors. Your chosen statistical approach is premised upon years of peer-reviewed scientific study and journal publications, actual implementation via LA region chronic toxicity QBELs beginning in 2012, and a decade of public comment. I'll close. I want to say I thoroughly commend your efforts to close more than 30 years. And I say 30 years because I remember the 1991 enclosed bays and estuaries plan and those plans that were not ever fully implemented in California. So I say 30 years, 30 years of deliberation on statewide toxicity protections for California's freshwaters and enclosed bays and estuaries. Thank you for considering my request for measures to improve the scientific rigor of your water flea study and listening to my thoughts on test endpoint.
Thank you so much, Ms. Stuber, for your incredible comments. Very well said and constructive. Particularly appreciate the thought and constructive comments around how we might already be thinking to structure the study to, again, build the confidence that we need, and the acknowledgement perhaps that some of the examples we've seen of variability weren't ever meant to get to sort of this question or to really understand what is the challenges we're seeing with C. dubia and C. daphnia and
the water flea,
the water flea, and its use within the state. So just thank you for your good and long engagement in this, and look forward to, if we vote appropriately today, to implementation. And so just thank you for your comments.
Thank you.
Next, I think we have up Patrick Vasey from Downey Brand.
Hi, good afternoon. Can you see my video? Okay, great. Again, good afternoon, Chair Esquivel and board members. My name is Patrick Vasey. I'm from Downey Brand LLP. First and foremost, thank you for letting us have the opportunity to speak prior to your taking any action on the adoption of the toxicity provisions. We continue to have several municipal wastewater clients with concerns in the North Coast, San Francisco Bay, Central Valley, and Los Angeles regions related to the proposed toxicity provisions. As expressed in letters submitted over the last decade by Melissa Thorm and David Elajam from our office, both of whom had existing conflicts and unfortunately couldn't be here today, our primary concern remains the use of the test of significant toxicity, or TST, prior to that being incorporated into federal regulations that would authorize the TST's use as proposed. I think it's clear that federal rules mandate that use of test procedures or methods approved under Part 136 for monitoring and reporting in NTDES permit compliance context. This is shown in at least 40 CFR sections 122.44 I-14 and 122.41 J4. As set forth in section 122.44 I-14B, one can only go outside the Part 136 methods where there are no approved methods under Part 136. That is not the case for chronic toxicity. The hypothesis test, NOEC, and point estimates are the approved options. The TST is not an approved option. The Clean Water Act requires all information on the measurement and classification of water quality to be promulgated and published in the Federal Register. And this is set forth in 33 USC sections 1314A2 and 3 and 1314H and I, A, and B. It's very apparent that it's clear that the TST was only in a guidance document. It's not a rule contained in Part 136. Besides being included in the Federal Register, the only other way that the TST could be authorized is through an alternative test procedure, or ATP. As you may know, the previous ATP was challenged and EPA withdrew approval, so no legal avenue currently exists to approval of the use of a single effluent concentration against a control using the TST statistical procedure. We saw and recognize that the staff response to comments state that a new ATB has been submitted to EPA, but that ATP would be subject to legal challenge on similar grounds. Most importantly, the toxicity is a method-defined element, and EPA has no guidance for ATPs for toxicity, making an ATP unavailable and not legally approvable. With a little bit limited time I have today, I just want to touch on the other issues that we believe leave the toxicity provisions legally vulnerable, including under CEQA for among other things, lack of adequate consideration or other alternatives, and inaccurate economic analysis that fails to contemplate the high potential costs associated with enforcement of these new limits, which may or may not reflect actual toxicity. Finally, I just wanted to point out that we did attempt to submit a comment letter last Friday afternoon. We were under the impression that we could submit additional comment letters on the recent changes made up till 5 p.m. last Friday, and we would ask that it be admitted into the record. But as we set forth in that comment letter, we request that the state board recognize the importance of its 4 previous precedential orders by stating that regional boards imposed non-narrative effluent limits for chronic toxicity after 2003, contrary to those binding decisions, and those limits should not be subject to anti-backsliding considerations. Most of those limits have been appealed and litigation has been avoided on most of those petitions, but permittees may have second thoughts if they think that these provisions will now lock them into limits forever. The other way that limits could have been removed was where a permittee no longer has reasonable potential, but the toxicity provisions removed reasonable potential analysis for most POTWs over 5 mgd, altering the normal process under the federal rules. And then finally, I would just mention that in our, we also mentioned in the comment letter that we submitted on Friday, with respect to new paragraph 16 for the resolution, it states in pertinent part, quote, the toxicity provisions do not change the test methods. The test method manuals contain specific requirements or recommendations on how to conduct a test, close quote. Again, we respectfully state that this statement is not only untrue, but inaccurate. The toxicity provisions do change the test methods, and the method manuals incorporate by reference into the Part 136 methods adopted by regulation in 2002. And those include more than requirements to avoid or prevent laboratory interference as set forth in the proposed paragraph 16. Thus, the paragraph is both inaccurate and misleading. With that, I would just again like to thank the board for their consideration for these important factors prior to adopting these problematic provisions.
Mr. Basie, appreciate your comments.
Thank you.
Next, we have Buchanan from Western States Petroleum Association, and I believe he will be joined by Dan Tormey.
Thank you, Board Chair Esquivel and members of the board. Thank you so much for this opportunity to testify before you today. Can you hear me?
Yes, we can, Mr. Bouchon.
Thank you. Before we get into our testimony, I just wanted to commend your staff for the work that they've done with us over the last several years. I think we mentioned 13 years it's been since we've been moving forward on with the TST component. I've worked with Karen Mogus and your other staff over those years, and their professionalism has been exemplary. They've always been accessible to us, and I've always been willing to listen to what we had to say in our concerns, and just wanted to thank you and your staff for doing that. The provisions before you today propose to change the regulatory landscape significantly for toxicity for many of our members as they discharge to the inland surface waters and enclosed bays and estuaries in California. Today, we wish to just focus on 2 issues. One is the Cereodaphnia dubia study, which I will call just Cereodaphnia, and also the substitute environmental document. Cereodaphnia can be very complicated in its testing for chronic toxicity due to its fickle nature. This has been documented in a lot of the scientific literature. And so with some of those problems having nothing to do with toxicity, we're not specifically focusing on false positives, but other issues that can be taking place where broods of Cereodaphnia could end up not being able to replicate themselves simply because of just the fickle nature of the species. We believe that the study that staff is moving forward with essentially supports the concerns about some of this variability. I know that the staff have made very clear today that the study's purpose really is to focus on improving laboratory precision with the method. But we think it would be incredibly valuable if that study would address some of these variability issues, at least in concept. So far today, I've heard testimony and also some board member indications that maybe through the stakeholder process that would be appropriate, and we would welcome that. The last thing, the second issue is the substitute environmental document, or SED. Staff have proposed the SED in lieu of a CEQA analysis, and we don't object to that. But generally, CEQA analysis will outline differences in opinion, or in this case, disagreement within the scientific community and literature. And we'd merely like to have staff incorporate that into the SED that's going to move forward for adoption, so that it documents some of the disagreement with using Cereodaphnia as a chronic toxicity testing species. And with that, I'll conclude my remarks. Thank you.
Thank you, Mr. Bouchon. Any questions or comments from fellow board members? Hearing none, thank you. Again, appreciated, and we'll continue to take in consideration the discussion here. Next, we have Nicholas Blair from the Association of California Water Agencies.
If I could just get a clarification, Chair Esquivel, my understanding was that Mr. Tormey was going to join Mr. Bouchon.
Yeah, I don't know if Mr. Tormey, did you have additional comment you were going to add?
No, I didn't. I was here if there were any additional technical questions, and hearing none. That's it.
And thank you, Mr. Loffer. Yes, next I think is Nicholas Blair from the Association of California Water Agencies.
Very good. Can you hear me?
Yes, we can. Good morning, or good afternoon.
Good afternoon indeed. Thank you, Chair Esquivel and board members. As noted, my name is Nick Blair. I'm speaking for Aqua today. I'm just going to restate some recommendations from our last letter, which have been detailed today, so I'll try to be brief. First, in tandem with Paul Bedore's comments that the State Water Board amend the 5 mgD permitted discharge rate for municipal wastewater treatment plants to enable regional water boards to have greater discretion in determining reasonable potential, setting effluent limits, and establishing monitoring frequency. Next, as raised by commenters such as Stephen Debson and Paul Bedore, through this whole process, Aqua has been concerned about use of the EPA guidance document regarding PST to replace requirements set forth in federally promulgated and binding regulations and incorporated manuals in Part 136, which suggests either the NREC or IC25 to replace PST in the final version of the toxicity divisions. Third, regarding the Cereodaphnia special study process, we concur with the statements raised by Paul Bedore and Jerry Wilson. We request that the Water Board consider and encourage broad stakeholder perspective through this process, starting at the meeting on December 8th. We appreciate the conversation today about from the panel on the board ahead of this study process.
Sorry, Mr. Blair, your audio is getting a little garbled. I'm sure it's the platform here. You may just want to speak a little louder. Thank you.
Can you hear me now?
Yeah, we can hear you okay. Thanks.
Very good. I was actually just about to wrap up. So I was just going to say thank you for the opportunity to speak today. We appreciate the hard work that staff has put in through this process. I'm fairly new to Aqua, but I can see that this has been going on for a long time and staff has worked very hard for a long time. So thank you to staff, thank you to the board. And with that, I conclude my remarks.
Thank you for that, Mr. Blair. I appreciate it. And kind of a plussing up of some of the comments that, again, we had heard from Paul Bedore, but appreciate Aqua's engagement on this. So thank you. Next, then we have, and I'll note that Adam Link, Cameron Irvine, and Brandon Dawson, I believe you're marked to speak if needed. You should go ahead and start to think if you will be wanting to speak, and I'll be calling on you then after Karen Cowan from the California Stormwater Quality Association.
Good afternoon again, Chair Esquivel and members of the board. My name is Karen Cowan, and I am the Assistant Executive Director of the California Stormwater Quality Association. We'd like to start by affirming our support for the intent to establish statewide consistency for aquatic toxicity testing and the protection of aquatic life beneficial uses in California. We'd also, of course, like to thank staff. I'm sure at this point, maybe you're never tired of hearing the thanking to staff and to members of the board as well. But truly, I mean, from our perspective, collaboration is the key to everything. And truly, staff has been, I think, fabulous in working with stakeholders through this process. So just again, reiterating the same thanks from everybody. We did meet with staff several times over the last 2 years to discuss some of the challenges from the stormwater perspective. And you've heard a lot from wastewater today. And through those meetings, we agreed with staff that rather than requesting modifications to the provisions at this point in time, the resolution would be the appropriate place to document and direct staff to continue the work necessary to resolve those issues. So our comments today really focus on the modifications related to the resolution. And almost as an apology, I guess, to Karen and Rebecca and Zane, we haven't had a chance to talk at the staff level just because the resolution is sort of the last piece of the puzzle here. So this may be the first time they're hearing some of our comments. So our first comment is a request for clarification on the intent of the language on page 11 of the resolution, resolve paragraph 7. This item directs staff through storms to prioritize an evaluation and consideration of aquatic toxicity implementation requirements specific to stormwater discharges. From a practical perspective, CASCWA has requested that the urban pesticide amendments that are currently under development largely serve as the implementation requirements specific to stormwater. We realize that there are obvious process and timing issues to consider and that the toxicity provisions are here today for you to consider for adoption and that the urban pesticide amendments are clearly still under development. Our request is to ask, just as a clarification from staff, that language in the resolution is essentially intended to refer to the urban pesticide amendments. The reason I'm asking is because we want to ensure that there is that linkage and consistency between the toxicity provisions and the urban pesticide amendments once they are ready to be considered, and that the language doesn't envision something different or in addition to the urban pesticide amendments. Our second comment is a request to add an additional item in the resolution that directs staff to develop a project through storms focused on the consideration of wet weather conditions and the development of water quality objectives. The variable nature of stormwater runoff presents unique challenges in accurately characterizing water quality and potential receiving water impacts. In terms of the toxicity provisions, we've commented previously that from a stormwater perspective, the science required to effectively characterize the duration, exposure, and environmental impacts of toxicity during wet weather events is lacking, and the application of the methods derived for continuous wastewater discharges is not appropriate. So CASCWA is not advocating for removing requirements during wet weather, but rather considering the science underlying the objectives for appropriate application to provide effective beneficial use protection, the conditions under which the objective should be applied, and the available technology to achieve the objectives during wet weather. Ultimately, we feel these considerations will result in a better understanding of the appropriate protection of beneficial uses under all conditions and the level of effort that will be required to attain those objectives to better inform policy development. These challenges, however, are not limited to the toxicity provisions, so we continue to advocate for consideration of the differences between storm events and dry weather flow conditions in all objectives. So again, our request today is not to modify the toxicity provisions at this point in time, but to resolve that broader issue at hand, applicable to all objectives. Therefore, our request for that project would have two purposes. The first would be to develop a model process for conducting a 13241 and 13242 analysis that specifically evaluates attaining water quality objectives in wet weather conditions. And the second would be to develop guidelines for determining the appropriate application of objectives during wet weather conditions, including but not limited to monitoring considerations, permit requirements, and compliance with permit provisions. And the third and final comment today is just sort of a note about future 303D assessments. We've raised concerns previously, both in comments and in conversations with staff, about how the toxicity provisions could result in 303D listings based on intermittent toxicity or false positives that do not indicate a beneficial use impairment and cannot be effectively addressed by a TMDL. Those concerns remain, and while we still support and would welcome the changes we've previously suggested, I'm noting it today just to ensure that those concerns are not lost as future 303D lists are developed and any regulatory or permitting actions based on those listings are contemplated. So if those concerns do come to bear in the future, we can commit to identifying any of those listings and working with State Water Board staff to identify any potential solutions. As always, thank you again for the opportunity to provide comments, and we're really thankful again for your willingness to work with stakeholders. Thank you.
Hey, Ms. Cohen, I appreciate the suggestions. I just, I don't know if Ms. Mogus or Mr. Bishop has a gloss or some thought on how we treat stormwater going forward, and particularly when it comes to the work with storms, the storms unit, but then also planned work around urban pesticide update of the work. Mr. Bishop, I don't know if you have some thoughts.
Yeah, I think that that is the whole purpose of storms, is to look at how to set standards for stormwater, take into consideration the difference between this periodic discharges as opposed to continuous discharges. And so I think it's appropriate for storms to be looking at how the best to implement toxicity. In one of our many earlier versions of the toxicity policy 4 or 5 years ago, it was proposed to just include stormwater and agricultural runoff in the same way as POTWs. And that was inappropriate because we don't have the same tools. I wouldn't commit at this moment to blending the urban pesticide with the toxicity into one policy. We will look to see if that makes sense, since many of the toxicity hits in stormwater are due to urban pesticides, but not exclusively. So there may need to be two efforts, or maybe they can be combined. We'll have to look at that before I can give you any definitive on that. Karen, did you want to add anything?
No, you said what I was going to say, that other constituents cause toxicity, but we certainly, as we proceed with the urban pesticides amendment, will be looking at what we're requiring in the toxicity provisions and make sure that we're not in conflict, which is what we do with all of our plans and policies as we move forward with them.
Thank you both. That's helpful. And perhaps at this point, not necessarily appropriate to adjust too much of the resolution language around it, but I appreciate, again, Ms. Cohen, the thoughts and the continued engagement around this. So thank you. Next, I'd like to call up Dr. Susan Paulson from Forest and Water Chemistry and Waste Project.
All right, can you hear me?
Yes, we can.
All right, thank you very much. Next, please, on the slides. I'm here on behalf of the SWRCB Water Quality Task Force and the Project on Water Chemistry and Waste. And both these projects are comprised of businesses and municipal and regional governmental entities with a lot of experience in this area. And we also would like to echo the thanks that everyone else has expressed. In terms of the availability of staff, they have made some significant changes that have greatly improved the policy, but we do have some remaining concerns. Next slide, please. The main concern really is with whether or not the TST represents a significant departure. And in our opinion, it does. The use of a control in a single effluent sample really moves away from the standard practice of using the full dilution series. And this, I think, is as others have expressed, a pretty significant difference in scientific opinion. Staff, I believe, intended to address this in part in the paragraph that they proposed for after paragraph number 16 in the resolution. And the change sheet adds some language there stating that it is not a departure, essentially, and we disagree. We believe that it's pretty clear that the EPA approved aquatic toxicity test methods include both the test protocols, and that's the dilution series, the requirements for conducting the tests, the QA procedures, et cetera. So the physical implementation of those tests. But also those methods include the statistical methods that are used to evaluate and interpret test results. The proposed toxicity provisions that you're considering today maintain the physical test protocols, how you conduct the tests, but not the statistical methods. And we do believe that that represents a significant departure. So the promulgated, just to elaborate on that, the promulgated test methods are codified in the US EPA 2002 guidance, which recommend that multiple dilutions be used for definitive tests, and also recommend that the regression analysis statistical methods be used to analyze the data, particularly in the context of compliance with NPDES permits. EPA's 2010 TST document was issued after the 2002 guidance, but did not change the promulgated methods. Next slide, please. Sorry, one more, this is backup if needed. One more slide, please. We recommend that you are likely to adopt the TST today. And so our recommendation to you is that some targeted language be included in 3 different places within the provisions to allow the dose response data from the multiple concentrations of effluent to be considered in evaluating the test results that are obtained using the TST. And really, a lot of this does come back to the Seria daphnia dubia test and the high variability and the uncertainty that that introduces into the test procedure. I remain very concerned by some of the data that's been discussed today. For example, the blanks that show findings of toxicity when blanks by definition should not. And that's a very important consideration. One way to address that today while adopting the TST is to allow the data from the multiple concentrations of effluent to be considered, so that if you have a response caused by organism variability at the IWC, you have the remaining parts of the dilution series that you can use to determine that and to establish what has really happened. This is also related to our recommendation number 2, next slide please, which has to do with Seria daphnia dubia specifically. We remain concerned again that blanks show positives, that this organism has inherent variability that we don't see with other organisms. And we believe that it's possible that the study that we're all collectively about to undertake may return results indicating that it is not appropriate to use the Seria daphnia reproduction test for compliance purposes. If that's the case, then it would be inappropriate for the target alternative to an effluent limit to automatically sunset. And so we have provided some language to the board to suggest that that sunset date not be automatic, but that the provisions be reopened if we're going to use an effluent limit for this particular test and organism in order to amend the provisions accordingly after we have the results of the study. And really, to echo another speaker as well, the concern isn't with Seria daphnia as a test organism, it's with the use of the TST in interpreting those test results and the loss of the information from the full dilution series. Next, please. The next recommendations, I'm not sure this one has been touched on by other speakers, but the other 2 certainly have. This one has to do with salinity and a concern with a mismatch, again, particularly for Seria daphnia dubia, between the salinity of the control and the salinity of a sample. So the standard test methods require or recommend the use of salinity of the receiving water, but the provisions give the regional boards the discretion to require freshwater test methods for discharges of freshwater effluent into saltwater receiving waters. And if there are salinity differences between the control and the IWC, that could result in stressing the organisms and appear to be a finding of toxicity when actual toxicity isn't present. So the change that we're recommending here is the addition of the language that's shown at the bottom of the slide, suggesting that this should only be allowed if it is confirmed that differences in salinity will not affect the test organisms. The 4th recommendation, next slide please, has to do with the flexibility and the timeframes for testing. And I think this has been discussed at length. We had also suggested some language that would allow some flexibility in both specifying target dates and times rather than an exact date and time for the initiation of tests, and related to the allowance of a routine monitoring test when it has a significant overlap with a second MMEL or MMET test. I won't belabor this point because I think you've already discussed this at length. And then the last point, next slide, please, is related to reasonable potential. And we would note, as other speakers have, that the reasonable potential determination procedures in the provisions are highly conservative because they use a 10% effects threshold rather than the 25% effects threshold that's used for the TST. We also note that really toxicity testing is intended to evaluate conditions in the receiving water, the conditions that would be experienced by the test organisms. And therefore, our recommendation is that reasonable potential be evaluated at the IWC. And we have provided some suggested language changes that would accomplish that. And I think that brings it to a close. I'd be happy to address any questions. Thank you for the opportunity to provide comments.
Thank you as well, Ms. Paulson. Much appreciated. Board Member Dodak.
A question for staff. I think many of the issues Dr. Paulson went through, we've already discussed, but the issue of salinity, if you could respond to that one, Ms. Mogus.
Yeah, the resolved, oh shoot, I don't remember the one about the test methods. The test methods do allow for salinity to be addressed within the implementation of the method. We also have a portion of the provisions that identify what test species should be selected based on the concentration of salinity in the receiving water. So that's pretty clear as to what species you need to select as a result. And when you have salinity issues, it's our assertion that you need to demonstrate that that's what's really causing apparent toxicity, and in which case you may need a control that mimics the salinity in the effluent so that you can control for that effect, which is all allowable under the method. And so we don't believe it's necessary to reiterate what the method allows for in the provisions to address salinity.
Thank you.
Thank you both. Mr. Board Member McGuire.
Yes, hi, thank you. So, thank you, Dr. Paulson, for your comments. Another issue that you just raised was your recommendation 5 on reasonable potential. And, some of the flexibility that the regional board, actually the permitting authority, has here in selecting a different in-stream waste concentration. If I get this wrong, please correct me, but, basically a different concentration for evaluating reasonable potential up against that pretty conservative 10% effect threshold. So I was hoping, Ms. Mogus, to put you on the spot yet again today, and I appreciate that. But if you could just kind of comment on that request from Dr. Paulson.
So we have attempted to the degree possible to be consistent with other assessments of reasonable potential that are outlined in the state implementation policy. And so for other constituents, the reasonable potential analysis is conducted at 100% effluent, even if a discharger is granted dilution credits. It is not assessed at the dilution that is representative of the effluent in the receiving water. And so to be consistent with that, we have indicated reasonable potential would be conducted at 100% effluent for aquatic toxicity as well. So that's our rationale.
If they so choose.
I don't have the SIP in front of me. I don't know if that's at the discretion of the regional boards. Maybe.
I'm sorry. I'm just looking at the slide from Dr. Paulson. They were suggesting deleting some language where it says, unless the permitting authority selects a higher concentration of effluent.
Oh, in that instance, that is a specific regional board who does choose to use a higher concentration of effluent for their actual assessment for compliance, because they have so much dilution that they want to be certain. So it's actually more conservative way of assessing aquatic toxicity and compliance with their permit requirements rather than the issue of reasonable potential. being conducted at 100% effluent. I'm sorry, I
Oh no, maybe there's some wires getting crossed here. Dr. Paulson, is there, sorry, am I missing something here? Is this a reasonable potential question or a compliance question?
Honestly, I think maybe it's both. It's if you're doing a TST with a control and your IWC, I think by definition allows for that dilution. So you're not testing 100% effluent unless at the discretion of the regional board with justification, they eliminate that and require 100% effluent. But I don't think it's clear in the reasonable potential proceedings, in the reasonable potential findings on page 18 of the policy, I believe that it suggests that reasonable potential should be conducted at using the TST at the IWC. But there's been this almost discontinuity or ambiguity about that. And our request is intended to avoid that ambiguity and to clarify that reasonable potential should be conducted at the IWC.
Okay, thank you. I'll just flag Ms. Mogus and staff if you take a look at that section, if you see something that looks inconsistent with the intent, just to raise that here, perhaps before we make any further voting today. So thank you.
Thank you. Board members and Dr. Paulson, much appreciated. Next up is Valerie Kincaid. And Ms. Kincaid, I apologize. I think your hand went up during Ms. Paulson's presentation, but I believe now it's your turn to speak.
Great, thank you. I appreciate it. Thank you, Chair Esquivel. Valerie Kincaid on behalf of the Irrigation District members of the San Joaquin Tributaries Authority. And we have two concerns with the resolution proposed today that I'll outline quickly, and then a suggested remedy for those concerns. The first concern is the characterization that this is establishing the inland surface waters plan. Previous board action has actually already adopted provisions into this plan, and it exists. So this should be properly termed as an amendment to that existing plan, not the establishment thereof. In addition, we think that this should probably be public noticed and shown that the amendments to the existing plan as they are, that hasn't been publicly provided. So that is one concern, is that this is not an establishment of a plan, it's an amendment of an existing plan. And we think that there's some notice issues with not recognizing that distinction. The second concern we have really are with statements in paragraph 3 of the resolution. These statements mischaracterize the State Water Board's authority by kind of mixing and matching its policy authority with its water quality control planning authority. These are very separate authorities that the State Water Board has per the Water Code, and mixing and matching them in the way that you do in paragraph 3 causes two problems. One, it unlawfully expands the State Water Board's authority. And second, and perhaps most concerning and reflective of some of the comments we've heard earlier, which is that it really disrupts the relationship that the State Water Board has with its regional boards. And that's that if you're going to create policy, you have to allow the regional boards to create regulations, and they come back to this board with those regulations for approval. So by kind of mixing and matching and expanding the authority of the State Water Board through provisions 13140 and 13170, you kind of supersede that delegation of authority to regional boards and don't allow them to come back to you with an approved plan, which of course I know is the purpose of this, is to override them, but you have limitations on that authority in superseding their plans, and we think that these go too far. So I appreciate the ability to make comments. I also appreciate that there's been a lot of stakeholder engagement, and if I apologize if I'm overstepping or if this is too bold, but one of the things that I would perhaps recommend is that there's another stakeholder group that the State Water Board could reach out to, and that's stakeholders often, unfortunately, that I represent, which are folks who are worried about the precision and rulemaking authority of the State Water Board. And we would love to hear about the proposals that the State Water Board is doing before they are noticed to the board at this late date. I really do feel bad coming in and having these comments right when you're going to adopt things, and it just puts us in an awkward position. So if we can be included in a stakeholder group of folks who are worried that we all act within the authority we have, that might not be your favorite group to talk to, but I think it would really help the process. So I appreciate the ability to make comments.
Oh, thank you very much for your comments, Ms. Kincaid, and always appropriate, and appreciate the expression of your sentiments. Would flag this was a 17-year process, and so the feeling of a lack of transparency around the discussion is perhaps we can do more, but I think all of our, as you well know, engaged at the level you are with our work, notice our discussions, our workshops, our process. When it comes to the titling of this particular item, I'll let Mr. Wiles maybe speak as to why that's the case. I appreciate the vigilance and the safeguarding of a feeling of overstepping of authority, particularly from a regulatory agency. So your comments are well received, but I think there may be, I think communication requires both sides to reach out. And I'll say that we'll continue to make sure we do well on our side and making sure that we are transparent and our actions are justified, and that we, as we always do, show our homework and provide plenty of public opportunity and comment to engage. So thank you for that. Mr. Wiles, there's I think a good bit to respond there too.
Yes, thanks, Chair Esquivel. Just a couple of quick points if I can. First, with respect to the issue that there's a notice problem because we're identifying the proposed board action as establishing the inland surface waters enclosed bays and estuaries plan rather than amending it. Ms. Kincaid is correct. The board has, on previous occasions, I think about 5 now, has adopted standalone portions of what was intended to become the inland surface waters plan and enclosed bays estuaries plan. But this is the first time that the board is establishing the framework for all of those previous amendments to go into. And so the difference here is that as it's been noticed since 2018, this version actually includes all of the chapters of a water quality control plan. It includes the introduction, it includes beneficial uses, water quality objectives, and then the implementation. And the bulk of what the board's considering today is, of course, the toxicity water quality objectives and the toxicity implementation. But it also creates this framework, including the other chapters. So as we described in resolution paragraph 3, the plan is at a future date. Staff will bundle up all of those existing rulemakings that the board has previously adopted that were identified as being intended to go into this plan. We will add some others at some point, including, for example, the state implementation policy, bundle those up and bring them to the board. For the items where we're not proposing any substantive changes, we'll propose this as an amendment, this future action, as an amendment to the inland surface waters enclosed bays and estuaries plan that doesn't have any regulatory effect, because it will essentially just be moving rulemakings that are already in effect into this document. That gets me then to the second issue, which is whether we are sort of conflating and impermissibly mixing up the board's authority under its authority to set state policy for water quality control versus the board's authority to adopt state water quality control plans. And in our view, and we explain this in the resolution also, is that the board does have the ability to adopt some of its rulemakings under both authorities, and that's what we're saying the board is using here, both its policy and its plan authority. But regardless, that any of the rulemakings that the board adopts that relate to water quality, we're taking the position that those can be housed in a water quality control plan. And that by and large, that's a mechanism that we're proposing to use in the future for the benefit of the stakeholders, so that they can actually find all of the relevant rulemakings that apply to protection of water quality in one place. And so that's what's on the table here is essentially today establishing the water quality control plan in the first instance, adopting the toxicity provisions as a key piece, but only a piece of that plan. And then with the expectation that in the future, we will be bringing back to the board to include additional plans and policies and other rulemakings adopted under both authority, plan and policy authority, to the board to include here. Last point I wanted to make is there is no requirement, as Ms. Kincaid stated, that the regional boards be given an opportunity to adopt regulations prior to the state board adopting a state policy for water quality control. I think she may be referring to the water code section that says that that regional board water quality control plans must be consistent with state policies for water quality control. But nowhere is there a requirement that the regional boards first adopt regulations or adopt even the regional water quality control plans that relate to the same subject prior to the state board adopting a state policy for water quality control. I think I covered all of the issues, but if there are any other questions, by all means, let me know.
Thank you, Mr. Wiles. Ms. Kincaid, want to be sure we are being responsive. Again, I can sense a great deal of frustration, feeling that here we are trying to implement something without the proper transparency or discussion with folks. I'm hearing that, particularly it sounds like it is kind of the arranging of the chapters and structuring for what will be a further discussion and real comprehensive sort of integration of the different components of the inland surface plan. But and again, it was noticed in 2018. It sounds like in that sort of format, this structure that we're talking about, which arguably was new. Did that go out on the LIRIS list, Mr. Wiles? Was that I just want to make sure understanding when that it was about 2 years ago then that the document structured as it is, this thinking that we would use it again. It sounds like to definitely structure the inland surface plan so as to begin to then incorporate in future work the different components that we've adopted. Here I think of dredge and fill procedures as well. These different we've chunked out what was an incredible plan to try to adopt all and update all as once. And I just want to make sure that we are being clear with the process and the appropriate times to engage. And when individuals like Ms. Kincaid or any other member of the public knows when to kind of be keyed in to needing to follow along with the notices and the documents that we're releasing to be prepared for a moment like this when we're having an adoption of the provisions.
Right.
Yeah, just kind of wanting to hear the LIRIS list maybe process there, and then from Ms. Kincaid, kind of addressing things here for her.
It looks like Chief Deputy Director Bishop has something to add.
So as embarrassing as it's to say, at the time that we released the 2018, it was going to be the first adoption of the next adoption of any policy for inland surface waters. We proposed at that time that we create the document to house these, because up until now, these just are floating out there in the ether. We have a thermal plan, we have an ocean plan, we don't have an inland surface water plan. And so that was the creation of it. It isn't to amend or change any policies, it's just to create a book to put these in, similar to the way the regional boards have a basin plan and we have an ocean plan, so that everyone knows where to find things. I personally found it very disconcerting when I got here and asked what our inland water plans are, and no one knew. They're just out there somewhere. So, Phil, you can jump in now.
Sure, yeah, and Chair Esquivel, just to the question about notice, yes, the 2018 version of the proposed water quality control plan for inland surface waters and closed basin estuaries did include what we refer to as the establishment of the plan. It was circulated to a couple of different sets of LIRIS lists or email distribution lists. The focus was to the folks who have subscribed to the freshwater standards, freshwater water quality standards list, but it also went out to the entire board meeting and board workshop email distribution list, because we also took it to the board. And as you may recall from this morning, when Ms. Mogus put up in the PowerPoint the amount of stakeholder interaction, it included several board meetings, board hearings, board workshops. Notice for those goes to the entire distribution list for anybody who's asked to receive notice of any board meetings or workshops. So yeah, on several occasions, it was circulated widely to all of our stakeholders, at least everybody who has decided to subscribe to the board's general mailing list.
Thank you for that. And
I might add, having been through this process since 2005, the structure has changed and evolved over time. It first started out as a proposed policy, I believe, toxicity policy, and then it shift over the years, decades, to what it currently is now. But in my mind, like Jonathan Bishop said, it was just a matter of organization rather than what Ms. Kincaid suggested. And I can't, off the top of my head right now, think of any other effort at the board that has undergone more public process, more engagement, more notification than this effort. Well, maybe WaterFix or something. But I'm fairly confident this is one area where we dotted the I's and crossed the T's when it comes to public noticing and engaging stakeholders and making sure that people are aware of this very significant effort. And as a result, as you know, there's been a lot of stakeholder engagement and a lot of stakeholder participation today.
Thank you, board member. Vice Chair.
Yeah, so I'm just trying to sort through all of this and appreciate that there would have been many opportunities for SJTA and others that are not involved at the level of detail that most of the core stakeholders are. And so I'm not as concerned about the issue of notice as I am about this broader issue of where's the plan, are we establishing it versus amending it? And I do remember, I've been confused too. I think we used to have the wetlands policy and then it became, the procedures. And then now we're looking at toxicity provisions instead of toxicity policy. And so I would just say that as we go forward with other efforts along these lines, to just be cognizant of this issue. I think that there's perhaps some litigation involved that SJTA is involved in with the wetlands procedures. And so maybe this is an issue that is, subject to legal interpretation. And so I would just say, as we go forward to maybe just take Ms. Kincaid's suggestion, if there are concerns about our authorities, just make sure that when we think of stakeholder groups to be reaching out to those, and for us as board members to just flag this issue. You can always give us, Mr. Wiles, your perspective, but I would find it to be helpful to just kind of have it be flagged that there may be a different perspective. It may not be a successful legal strategy from the perspective of others, but just to at least flag it for us, because I feel like even though I don't understand the technical level of detail that we're talking about here today, I do feel that I've heard many of these arguments, pretty much everything, have heard about it either through our workshops or staff workshops that I've attended, but this is a new issue. And so, maybe just, I still think we need to go forward, but it causes me to just be a little concerned. And so I think, putting this in the proper discussion framework for us as we go forward with, ongoing pieces that we're putting in. And then I guess the other question is, when is the plan coming before us so that we would see it in total?
Sure. So let me confirm, yes, there is litigation. Ms. Kincaid has brought on behalf of the San Joaquin Tributaries Association against this board related to the board's adoption of the wetlands policy, the dredger fill procedures. This is one of the issues that they have raised in that litigation. It's the first time that they've raised the issue with respect to this rulemaking today. And so that's why we hadn't identified this as an issue to the board members prior to today. It just hadn't come up yet. So, I mean, essentially, Ms. Kincaid sort of explained their view is that policies, I don't want to put words in her mouth, please correct me if I'm wrong, but that a state policy for water quality control cannot be incorporated into a water quality control plan. And that's one of the main issues that they are suing us over on the dredger fill procedures. So there's actually a hearing Friday, first hearing in front of the judge, where we'll maybe get a sense of where at least this judge is leaning on that issue. And we'll be sure to let the board know where the chips land once we have a decision, of course.
Thank you.
But I guess I should say that, our view is it's a valid rulemaking. It's been a whole lot of effort to get to this point. And certainly the fact that the board is adopting this as part of its water quality control policy and part of its water quality control plan authority, we're going to be recommending, as Jonathan and board member Dodick said, we're going to be recommending that we do this in the future for the ease of the stakeholders, unless the courts tell us that we can't, or unless the board decides to give us different direction.
And I'd like to just respond to the question about when we anticipate bringing it to the board. And while I think it's ambitious, our goal is to get it before the board before the end of 2021.
That's great. That's very helpful, Ms. Mogus. And thank you, Mr. Wiles, for the response, and board members for the discussion here. Thank you, Ms. Kincaid, for, I know what are in good faith comments. And if they had been part of the written comments submitted months ago, we could have had an earlier discussion about it, but appreciate it. And thanks again.
Thank you. Thanks for the consideration. Appreciate it.
Next, we have a tranche of speak if needed, and then looks like a new addition, Mr. Mark Gold. I'll go ahead and just start to go through the folks that were listed as speak if needed. Mr. Adam Link.
Hi, can you hear me?
Yes, we can.
Great, thank you. No, this is Adam Link on behalf of the California Association of Sanitation Agencies. I don't have really anything in addition to add to what a lot of the folks from the POTW community said, especially Jared Voskel, who's a member of our staff. And just wanted to say thank you all for working with us and meeting with us and sort of getting this towards the finish line in a place where we might be a little more comfortable. And we look forward to working on the Stereo study over the course of the next couple of years. And, I just echo all the comments that were said already. So thank you very much.
Thank you, Mr. Link. Appreciate that. Cameron Irvine.
Yeah, hi. Can you hear me?
Yes, we can. Good afternoon.
Okay, let me start video. Hi. Good afternoon, Chair Esquivel and board members. I'm Cameron Irvine with Robertson Bryan Inc. And I filled out a blue card as a backup for my colleague, Paul Bedore, who was able to provide our comments to the board earlier. So I don't need to take up any more of your time other than to say thank you to you and to board staff for considering the concerns of our clients over the past 2+ years. And especially to board member Dodick's request for an additional information item to the board once the dubia study is planned, and for being open to the stakeholder advisory committee and expert panel to develop an appropriate plan for that dubia study. So thank you.
Thank you for those comments as well. Yeah, I think we are pointing to the stakeholder process to make sure we get that best study in place and that it's consensus based so that we answer what is, again, and build confidence into the board's work. So thank you, Mr. Irvine. Brandon Dawson with the Sierra Club.
Hi, board members. This is Brandon Dawson with Sierra Club, California. First, I want to thank the staff to work on this. We support today's adoption as it's long overdue and largely attribute our comments with that of California Coastal Alliance and Heal the Bay. So I won't take too much of your time, but I want to emphasize 2 points really fast. First is that we do believe that the board has done a robust stakeholder engagement process, and while we weren't able to participate as much as we wanted to, we were included in that process. So we want to thank you all for that. And then second is the fact that we believe that the provision should apply to all dischargers to fully further the goal of statewide consistency. We know that the board is very transparent and open about how consistent they want all the state water quality control standards to be. And so consistent objectives are the most effective way that a regulatory approach can really provide for the protection of aquatic life and human health in California. So with that, I just want to make sure that those were mentioned, and I want to thank you all again for your work on this. Thank you.
Thank you, Mr. Dawson. And last, we have Mr. Mark Gold from the California Natural Resources Agency.
Hi, I just couldn't, this is Mark Gold, and I'm Deputy Secretary for Coast and Ocean Policy and CNRA, as well as the Executive Director of the Ocean Protection Council. And I couldn't let such a momentous moment pass. I'm guessing that very few people remember that I was one of the people when I was way back at Heal the Bay who actually brought the toxicity policy issues to the regional board, which then brought it to the State Water Resources Control Board way back in 2003. So to think that here we are 17 years later, finally at the finish line, cicadas are coming out at this point, is just really glad to see the State Water Board ready to take the step. And so I support the toxicity provisions in the water quality control plan for inland surface waters as they apply to coastal watersheds, which is obviously what we're focused on at the OPC, as well as enclosed bays and estuaries of California. We're pleased that after more than 15 plus years of discussion on approach, on TST, et cetera, that you are going with that approach. I hope the Cereodaphnia work could occur as quickly as possible, since Cereodaphnia is often the most sensitive species in these sorts of situations on toxicity. And just a reminder to everybody that the safety net in the Clean Water Act, as well as the Port of Cologne Act, I really strongly believe is toxicity testing and toxicity provisions. When you have millions of chemicals on the market at any given time, and you only have 126 priority pollutants that are monitored on a regular basis, you really need a strong toxicity provisions within the Port of Cologne Act to really make a difference in protecting water quality and aquatic life. And that I commend you for taking this step and offer my strong support. Thank you.
Thank you so much for your historic engagement as well on all of this. I think, to your point, it is an incredible feat to be able to get to this point when it comes to just having a better program in place, knowing that our toxicity testing is that backstop, that we're under a deluge of a number of contaminants of emerging concern that we're tracking on the drinking water side, let alone just environmentally that we know. And this really does provide the safeguard ultimately into the generations ahead, ensure that we are maintaining the quality of our state's waters for all of our benefit there. So just thank you for that.
Very well put, Chair Esquivel. Thank you.
And with that, I think it brings us, and I apologize, I burned us a bit through lunch. I did want to just be able to kind of maintain the discussion and momentum in getting through all the really good comments, and appreciate all of them, even those that aren't supportive still, and very still cautious about the board's approach and adopting the TST and these procedures here and provisions rather. But I appreciate, again, the good engagement. So where does that leave us here? I think, what we, I would like to ask staff, I think we need a lunch first and foremost. So would like for us to synthesize our direction for, I think there was a discussion of an additional resolve perhaps to kind of encapsulate some of the discussion we had here. Mr. Bishop, do you want to go through what your best gut is, and then we can give a nod, or how do we want to best proceed with folks? I know at the start here, we did have a pretty good list of items and suggestions, but.
So I think that throughout the conversation, we narrowed it down to essentially a new resolve to look at a number of items to report back to the board on, and I'm not going to get them all off the top of my head, but we have written them down: the matrix, the implementation, the monitoring, the time that it takes for labs and dischargers to meet the 3 tests when that's appropriate. And we believe that we can do that in one additional resolution item, and staff is working on that. I don't remember any others, so I would appreciate it if I missed something that the board was looking for.
I think that was a pretty good list to my mind of the discussion. But board members, is there anything Mr. Bishop is missing? Okay, I think that sounds like the heart of it.
So I don't want to sound pessimistic, but I would like staff to be able to eat and work on this instead of just work on this. So I would suggest an hour break so that they can have some food and work. And me too.
I think that's appropriate.
And pardon me for interrupting. And to be clear, there are, I think, a few items that the staff would like to address as well, and they need a few moments to gather things that they heard that may not have been questions from board members, but we just want to clean up the record. So that hour could be well used. The other point is the board does have 2 items on its closed session, and we might be able to at least allow the board members to eat in peace and then spare like 30 minutes of that 1 hour to do a closed session on the administrative hearings office item.
I think that sounds like a good suggestion. And so let's go ahead and take an hour, say, hour and change, so we can come back at 2:45, we'll say. That makes sense, but let's say 2:45.
Chair Esquivel?
Yes.
Chair Esquivel? We have another matter. We were hoping that a couple of our board members would be able to step away for 10 or 15 minutes right at straight up 3 o'clock to open the listening session. I know that's slightly awkward, but I do think it sends a message to have somebody from the board. So,
well, then how about we'll say 50 minutes, and we can try to come back here at 2:30. So maybe 30 minutes then for us to discuss, evaluate, and potentially then finish this item. Otherwise, how long would it be at 3 o'clock for a break, you think?
I don't, well, you were there. You participated in yesterday's session. I think just
okay.
10 or 15 minutes, yeah.
Okay, we can always break. So would we rather just go all the way to 45 then, or is 2:30? I don't know.
Personally, I would suggest going to 2:30 to give yourselves 30 minutes to clean this up before the board members have to break to go to the listening session. And I think that'll give staff enough time. And if you all are able to eat in 22 minutes, we can have the closed session begin at 2 o'clock.
Thank you, Mr. Lawfer, for your decisiveness. And that sounds good. So we will reconvene here at 2:30 to finish item number 5. And board members, we will gather in closed session at 2 o'clock. Thank you all. Thank you all for, I know what has been a long morning and into the afternoon here, but incredible work and good discussion. So thank you for everyone taking that time. We'll see you all back here again at 2:30. Hello, everyone. We're just coming fresh off of our closed session, so I know at least Mr. Loffer will have a moment to get back down into the hearing room. So just bear with us a moment as we all transition back in here. And will it be Mr. Bishop or Ms. Mogus that will lead us through? Mr. Wiles, good to see you.
I think I drew the short straw. No, just kidding. It's a privilege. I have just a couple of sort of housekeeping matters, and then I'm going to hand it over to Karen, to Ms. Mogus, to come back with the proposed text for the new resolution paragraph and one other small change. First, I just wanted to mention that in change sheet number 2, somehow we ended up with a couple of different versions, and the version that was sent out via Lyris to our email subscription lists and the version that was on the Ms. Mogus's presentation today for the board, that's the correct version. The version to change sheet number 2 that was linked to the agenda had a typo. It's an obvious typo, but it had the letter S in front of the word which. So just in case there's any confusion, we did not intend to include the typo in the change sheet. And then the other issue I wanted to address is we did receive some comment letters late. Our July notices had established a deadline for written comments, and the notice for this meeting indicated that oral comments would be accepted, but no additional written comments. So we're not going to recommend that the board accept those late comment letters into the record, but I did want to be clear that in almost all cases, the issues that are raised in those letters are issues that had previously been raised in other written comment letters. They were all addressed by the speakers today in their oral comments. But there are 2 that I just wanted to touch on very briefly because they haven't been responded to because they actually were mentioned orally today for the first time. They're very simple issues, I think. The first is just that the comments from WISPA made a sort of an analogy to a CEQA concept for where there's a disagreement of experts. You can, in some cases, identify that disagreement as the leading to a potential significant environmental effect. But that's not what we're talking about here. The staff report definitely includes a discussion of environmental effects, part of the environmental analysis. But the disagreement of experts that WISPA was referring to is related to the laboratory issues with dubia, which does not relate to any environmental analyses or any environmental issues. The second issue I wanted to mention briefly is in the letter from Downey Brand that came in last week that we're not recommending the board accept into the record. They did raise a slightly new version of an old argument. The argument is that the State Water Board, starting in 2003, said that it was going to evaluate the propriety of including effluent limitations, numeric effluent limitations for aquatic toxicity. Of course, this is perhaps today going to end. If the board does act to adopt the toxicity provisions, this will be the final evaluation that the board called for in 2003. But Downey Brand is arguing that any permits that were issued between 2003 and now for POTWs specifically that include numeric effluent limitations, that those limits are somehow not valid or at least were not authorized by the state board. So I did want to take this opportunity to let the board know that there were at least 9 petitions that were filed. They have all been in abeyance. So the POTWs and Downey Brand have not been asking the board to actually evaluate or analyze those permits to see whether they should be upheld or overturned. However, on November 12th, we did receive a letter from Downey Brand asking that those 9 petitions be removed from abeyance and activated. So I think up until now, we have told you that all of the petitions have been in abeyance. I want to say that as of today, that's no longer the case, that they are now active. And so that means that the board has some portion of the 90 days available to it to evaluate whether or not it wants to take up those petitions. So that's the current state of affairs. And I think if there aren't any questions, I'll hand it over to Ms. Mogus.
Oh, thank you. I appreciate it, Mr. Wiles, and the covering of items that were asked to be included in the written record that, again, at least for our benefit here and part of the verbal and oral record, we've discussed and are aware of. So thank you. Ms. Mogus.
Yes, so Janine, Rebecca sent you an email with a new resolved and a change to the change sheet. There we go, perfect. But before I get into these last couple of items, I did want to mention that I misspoke when Dr. Paulson was referring to reasonable potential conducted at the IWC versus the 100% effluent. The provisions, in fact, require reasonable potential to be conducted at the IWC, not 100% effluent. So just wanted to clarify, I absolutely got that wrong. And had I been sitting with my team, they could have kicked me under the table, but we're remote. So that one. And then I also want to make sure that I mention Steve Camacho as one of our key people on our team. I missed him in my introduction slide and did not mean to, but wanted to make sure that I let you know that he has also been a very critical part of our team working on all of the documents and responses to comments. So with that, I'm going to start with the revision to change sheet number 1 because it is, so it's at the bottom of the page. It's relatively minor change, adding the words on or in the first sentence of the provisions that are shown there. If the permitting authority issues, reissues, renews, or reopens the NPDES permit on or after January 1, 2024, so that you don't get January 1, 2024 as your grace day, right? So just clarifying that in change sheet number 1. And then going back up to the top of this proposed change to the resolution. This is in response to what we heard during the discussion prior to the break. We've added, or we're proposing to add another resolve number 11, and I will just read it out. Directs staff to provide the State Water Board a report by July 2023 on the implementation of the toxicity provisions, including reporting on coordinated toxicity sampling, laboratory logistics and costs, aquatic toxicity metrics, and there are examples of monitoring frequency, violations, frequency of toxicity reduction evaluations, information on aquatic toxicity monitoring efforts across water board programs, status of efforts to prioritize an evaluation and consideration of aquatic toxicity implementation requirements specific to stormwater discharges, the discharger's experience initiating 3 aquatic toxicity tests, for example, 1 routine monitoring and 2 MMEL compliance tests in 1 calendar month, and conducting replacement tests, and any implementation challenges. So we think we captured the tranche of things that we're supposed to come talk to you about in 2023. I did want to mention that we are also committed to bringing an information item back to the board in early 2021 with the objectives and design of the Cereodaphnia study once the stakeholders and expert panel have met and weighed in on that. So with that, that's what we're proposing to add to the resolution.
Board Chair, if I may. Hi, this is Elizabeth Barrett. I noticed that there is a slight copy and paste error into the sheet that was provided just now. So I just wanted to read into the record the changes for the provisions in section 4B2E2. So excuse me, in section 4B2EII, the language would be, if the permitting authority issues, reissues, renews, or reopens, parenthetical, if the permit reopening is to address toxicity requirements, the NPDES permit on or after January 1st, 2024, the permitting authority shall include the MDL indicated in section 4B2E III and the MMEL indicated in section 4B2I4. Thank you, Board Chair.
Appreciate that. Thank you.
Mr. Chair, would you be willing to entertain a motion at this point?
I think so, and was just going to say thank you. That was a very accurate and good synthesis of what was, I know, a lot of requests still from us and in response to what we heard. And so thank you really everyone for synthesizing what I feel really captures some of a number of the discussion we had here, and also appreciate then coming back with the survey, because I think we heard again and again how the survey is structured, what it's asking, cost of it, et cetera, is really important to everyone and to us. And we want that confidence that everyone moving forward is bought into the study. So just wanted to say all that.
Okay.
Mr. Bishop, sorry, Vice Chair. Mr. Bishop, is there something you're wanting to say?
I just wanted to comment that we completed our work on it at 2:30. Exactly.
Extra bonus points for that. No, thank you really for the thorough work, everyone. I know it takes a lot to get to this point, so just thank you. And with that, I'll let the Vice Chair make a motion.
Thank you, Mr. Chair. And I just wanted to jump in to make the motion because I had some comments that I wanted to make as part of it. As Karen Mogus indicated, this has been almost a decade-long effort, and this issue came before. I had the first opportunity to deal with this issue when I was on the board for maybe 2 months. SEEB asked that I do a presentation on the toxicity policy at their summer issues conference, and I felt like that was probably the greatest punishment that a new board member could possibly receive. And but I spent a lot of time on it, and I tried to understand it, and I was very uncomfortable with it at that time. And then through the years, I have seen this evolve from something that was very complex and difficult for us to even quite explain to stakeholders that would need to comply as to the need. And I just saw a lot of pushback, and then of course, desire on the part of the NGOs for us to go forward, and frustration that it had taken so long. And I think that this has evolved into a very balanced, well-articulated place to be. And I just really appreciate the extra time that our staff spent on this. And for you and your leadership, Mr. Chair, to just commit to spending the additional time. I think that it allowed us to get to a well-balanced place. We are very clear about what's expected, but we do have some areas of flexibility. And it's quite telling that we had many stakeholders come before us today to thank our staff for the additional time and to listen and understand their concerns. I don't think we had anybody walk away fully satisfied. But other than, the comment by Ms. Kincaid that we talked through, there really were no concerns about process. And so I think that it's, a compliment to our staff for the good work that they did on this, and to all the stakeholders for just rolling up their sleeves. And I do appreciate the one workshop that I was at where I saw stakeholders just put down their talking points and be creative. And so you all helped us to get there. So with that, I'd like to make a motion for, and Mr. Loeffler or Mr. Wiles, feel free to jump in and help me out here, but to adopt the resolution with changes that were displayed and discussed by Ms. Mogus, and then changes read into the record with respect to both change sheets 1 and 2, and the changes read into the record by Ms. Barrett.
Yeah, the only clarification I would add is that there, I believe it was Mr. Wiles who pointed out the additional clarification on the change sheet that was improperly distributed or posted on the board's website. But otherwise, the motion is fine. It is the resolution, the 2 change sheets, the change sheets to the resolution reflected by Ms. Mogus, and the additional resolved 11.
Yes.
Do I have a second?
I'll second.
Great. Ms. Townsend, can you please call the vote?
Yes. Vice Chair Diadamo?
Aye.
Board Member Firestone?
Aye.
Board Member McGuire?
Aye.
Board Member Dodek?
Aye, please.
Chair Esquivel?
Aye as well.
Thank you.
Thank you as well, Ms. Townsend. The vote carries unanimously, and just congratulations and just thank you to Board Member Dodek, Vice Chair Diadamo, and Board Member McGuire and Board Member Firestone, and really our program staff who have done an exceptional job at balancing and continuing to work through and accepting and being open to flexibility where appropriate while still maintaining the core integrity of the project and the comprehensiveness of it. And again, we heard a good comment about how we should continue to proceed and ensure that these toxicity provisions provide the broadest protection and coverage as we can, and appropriately tuned to different sources in dischargers, knowing that whether you're point source or non-point source, these things make a difference. But just incredible moment, and congratulations and thank you to everyone that's been with us in this long process, and acknowledge I've only been here 4 years, and so the great bulk of the work so many of you take credit for here. So thank you. Ms. Mogus, Ms. Fitzgerald.
Just want to say thank you. Really appreciate the early Christmas present.
And how much I appreciate you, Karen, and all of your leadership and guidance on this very, feels really good right now. So thank you.
Thank you all. Really, really appreciate it. And with that, we conclude item number 5. And just thank you again, everyone. So proceeding here into our last item, I believe, is simply board member reports. Yes, number 6. And would entertain any reports fellow board members would have. I would just reiterate, thankful really for also the great work from our Office of Public Participation. And I have to give a shout out to Adriana Renteria, who's the head of that office, and Nefertiri Cooley, who is our communications director as well. And so much of our committee, Greg Gearhart, Deldy Reyes as well at Cali, PA, Yana Garcia at Cali, PA as well. It has taken an incredible assemblage of folks to really pull off these racial equity listening sessions and the continuing work internally that we're doing. So I just want to say thank you. I participated yesterday to kick one off. Right now, board members McGuire and Firestone, I think will be heading to their opening here. And so just want to thank, and I think that's been the most sort of significant public engagement moment I had these last couple of weeks, and had a restful Thanksgiving, and hope you all did as well. So being mindful of time, board members Firestone and McGuire, if you'd like to go next to make sure you guys make your opening.
Yeah, just briefly, thank you. Let's see, on the 18th, we did the recording for the Aqua conference, which will be played back Thursday morning at 9 a.m. And it's a follow-up on the COVID-19 financial impacts panel that I was fortunate enough to participate on back in, I believe it was late July. And so I wish I had the update that I was given this morning from Max and Darren, because I would have shared them that good news in my recording 2 weeks ago. But I'll try to fill in on Thursday with the Q&A session. Anyway, it's good all around. Very good, obviously, engagement from Aqua, and so just wanted to highlight that they continue to be interested, and hopefully we'll have good participation in that discussion. That's it for me.
And I also did a recording on as part of Aqua panel on the SAFER program, along with Andrew Altfoot from Division of Drinking Water. And I also just wanted to put in a plug of the great work and sort of significant workshops that are happening around the needs assessment with the right now. So before Thanksgiving, there was a workshop on the cost methodology. And then coming up this month is a workshop around the risk criteria, scoring, thresholds, weighting to determine the at-risk list. So these are all things I think the staff have been doing an exceptionally thorough job of analyzing, getting information out to stakeholders, and holding workshops that have gotten really good reviews from stakeholders as being really helpful. So just a thank you to staff and a flag that those are happening. And I think this is a really critical moment within the needs assessment development process that will impact the SAFER program going forward. That's it. I definitely am looking forward to the listening sessions. And so I'm probably going to have to sign off now. I just wanted to make sure we're not having another closed session, right? In this meeting,
Yeah. I was going to mention that we should probably break, and then we will still have we have a personnel closed session, and we can have that once you and Sean are done.
Okay, great. Okay, thank you. All right, thank you.
Board Member Dodek, Vice Chair Diadamo, no reports? Okay, that's fair. Hope it was a good Thanksgiving. And well, with that, it concludes our items here and brings us to the end of the board meeting. We will be going into closed session. Let's go ahead and say 3:30, I think would work. That'll give enough time for board members McGuire and Firestone to participate in the opening, and then we can transition to our closed session. Mr. Lawford?
Yeah, the only point I was going to make was that we're not actually concluding the board meeting yet. The public meeting is being recessed while the board adjourns into closed session, and that closed session resumes at 3:30. And for clarity of the record, the closed session will solely be on the personnel matter.
Thank you for that, Mr. Lawfer, for that clarity. And well, with that, we again will reconvene in closed session as board members here at 3:30. And thank you all for today's good discussion and vote. Thanks again. Take care.